Welcome everybody to day 2 of ACF Tribal Consultation. We are right at the top of the hour. My name is Lee Allen. I'm going to be one of the hosts for today. Wanted to cover a little bit of housekeeping before we get started. So right now everyone is in listen-only mode. Your lines are muted. As we go through the course of the day, there will be prompts from Chairman Sullivan when it is time for tribal leaders to provide input. At that time, please press *# to enter the phone queue. Those calls will be taken in order, and you will hear a pre-recorded prompt when your line is unmuted and it is your turn to speak. Everything in the chat box, feel free to use that. That will become part of the records for this consultation. So if you have comments and you don't have time to speak, you can enter those there. We will also have, you can submit written testimony until August 11th. So for 60 days, that comment period is open. And those can be sent to ANA-commissioner@acf.hhs.gov, and we will have that provided throughout. We'll give it just another moment to let people continue to join, and then I'll turn it over to Commissioner Hovland.
Tehaniwashte, good morning, and Petuwashte, good afternoon, depending on where you're at in the country. Madakayabi, Chantewashte, and Apechuzapi, Jeannie Hublanamachiabi, Santioyate Matan, Commissioner to Administration for Native Americans at Wawashi Chamu. My relatives, I greet you with a good heart. I'm Jeannie Hubland. I'm a proud member of the Flanders Santee Sioux Tribe, and I'm Commissioner of the Administration for Native Americans. And I want to welcome you all to the 2020 Administration for Children and Families Tribal Consultation. This is our second and final afternoon of this annual consultation today. We will begin this meeting with a prayer from Vice Chairman of the Bishop Paiute Tribe, Topher Denver, who represents the California region on the ACF Tribal Advisory Committee. Mr. Vice Chairman, please open us in prayer.
Good morning, Jane. Can you hear me?
Yes, we can. Thank you.
Okay, Manahu, and good morning, everyone. Manahu in our Numa Idua language means hello. I'm very honored to give this prayer this morning. And again, think of prayer as always being strong and continue to offer prayer every day for our people. I'll go ahead and provide a blessing. Manatunis, grandfathers, thank you for this day you've given us. Be with us today that this meeting will be good in many ways, that we have good hearts, good thoughts, and have good minds. Special prayer to all those out there that are suffering from the COVID-19, that you watch over them and protect them. All our communities that are affected, please, grandfathers, we ask for special prayer for all those affected. And again, grandfathers, for those who have lost their loved ones, be with those families, that you comfort them and guide them through these hard times. We ask, grandfathers, a special prayer for all our people, that we continue to have our traditional ways, our customs, our languages, that we help our young learn these. And again, through all these programs, grandfathers, we help our people move forward in today's complicated world. As always, grandfathers, be with us today and be with everyone out there, that we continue to work together in good ways for all our people. Manu. Stay healthy and safe, everyone.
Pidamiye, thank you, Mr. Vice Chairman, for opening our session in a good way. As I mentioned before, my name is Jeannie Hovland, and I serve as Commissioner of the Administration for Native Americans. This is a dual role, so I also am Deputy Assistant Secretary of Native American Affairs within the Administration for Children and Families. Excuse me. I would like to introduce our tribal moderator for today, Mr. Chairman Jeremy Sullivan of the Port Gamble Squalam Tribe. Chairman, thank you for joining us again today. You did a fantastic job moderating, and I'm glad that you're back again for day 2 to join us. Before we start our session, I feel it's important to acknowledge the recent and tragic events in our country. I shared this when we met yesterday, but it is a message that is worth repeating, and also some of you might not have been present yesterday. As Native Americans, racial, economic, and health inequity, as well as violation of trust, is nothing new to us. The horrific death of Mr. George Floyd is a sobering reminder of the traumas experienced by our people, and that our work to demand equal respect and fairness is not over. Since May 25th, which happened to be Memorial Day and the date of Mr. Floyd's tragic and unjustified death, many Americans have come together to call for change. Individuals of all ages, all races, and all backgrounds are standing together for the cause of racial parity and basic human rights. We have a powerful opportunity before us to educate and unite. Mr. Floyd's death must not be in vain. Wherever you are, continue to stand for justice, human equality, and pray for our nation's healing. Our children's future and that of our communities depends on it. Thank you for giving me a few moments to share from my heart. At this time, Mr. Chairman Sullivan, I'm going to ask you to introduce yourself and give some brief remarks. Thank you.
Thank you, Commissioner Hovland. I appreciate this opportunity to co-chair with you, and it's been a great couple of days. I've really learned so much from the questions across the country, as well as the guidance that you and your staff have given. It's really been a blessing to be with you here. My name is Jeremy Sullivan. I'm chairman of the Port Gamble Squalam Tribe. We're a small tribe here in Washington State. It's morning over here, so good afternoon to all those on the other side of the country. I just want to say that I really appreciate how much work is being done in Indian country. Child and Family Services are so important to our communities, and I know the people that work in Child and Family Services really care and are passionate about their work, and that is the difference. That makes the difference. That makes the positive change. You know, I really appreciate that, and you know, this world needs that kind of change, that positive, turn lives around, make them better. Help people in need and get them off the ground and up on their feet. So I just really appreciate this opportunity. That being said, I'm just going to go ahead and cover a quick housekeeping. As was stated earlier, this consultation is being recorded so that an accurate record can be made of today's discussion. During today's consultation, we will follow the protocol of tribal leaders having the opportunity to speak first, followed by a designee, and then open the floor up to others who would like to question or provide comments. We ask that when it is your time to speak, that you provide your name, title, tribe, and your organization affiliation. To ensure that everyone has a chance to speak, please keep your comments as brief as possible. You will be in listen mode only for the duration of the consultation. When you are ready to give a statement or ask a question, please note that we are only using the phone option today. Please press *# on your keypad to be placed in the queue. When it is your turn to speak, you'll be prompted on your line. It will tell you that you are unmuted. You may also submit questions or comments by typing them into the chat box. Comments in the chat box will be retained as part of the written record. The record will be open for 60 days, and written testimonies may be submitted during this time to anacommissioner@acf.hhs.gov. Commissioner Hovland will now begin the formal consultation.
Thank you, Mr. Chairman. And yes, we are now formally starting the consultation and will begin recording. I want to welcome back the Assistant Secretary of the Administration for Children and Families, Lynn Johnson. I am so grateful for her strong leadership across ACF. She has been a strong advocate for inclusion of tribal citizens and communities in the ACF priorities, and that was made very evident during the COVID-19 response. Thank you for your leadership, Assistant Secretary Johnson, and for joining us again for today's consultation. Assistant Secretary.
hear me?
Yes, we can.
Okay, fantastic. Thank you. Good morning and good afternoon to everybody that is listening, and thank you to everyone who put effort into making this consultation happen. It is a special thanks to tribal leaders and representatives who participated in yesterday's ACF Tribal Consultation session. Our engagement with you demonstrated that virtual sessions do work. A little tricky for a little while, but we did figure it out. I committed to joining you today to share a summary of your COVID-19 comments and priority recommendations for ACF. Yesterday, we heard very clearly that this time is proving very challenging as you rise to meet the demands of keeping your citizens safe and healthy while trying to continue to provide the vital social services like Head Start, child care, and domestic violence prevention. We heard that your families are under enormous spiritual, emotional, and physical stress, that you are struggling with how to provide services that meet their needs, especially the cultural needs. We heard that you have financial struggles more than ever as tribal governments, and we can be helpful by providing clearer instructions on what program requirements will be waived. So I want to thank you for comments and assure you that we heard you, and our team will make every effort to provide you with the support you need. We were pleased to provide additional funding for child welfare during this difficult time. On April 23rd, the Administration for Children and Families awarded over $1.1 million to 178 tribes in Supplemental CARES Act awards for the Stephanie Tubbs Jones Child Welfare Services Program. This is the Title 4B, Subpart 1 of the Social Security Act. Funds may be used to prevent child abuse and neglect, protect children, support the child welfare workforce, and ensure the safety, permanency, and well-being of children and families involved in the child welfare system during the coronavirus pandemic. ACF is aware of tribal interest in the final rule for the adoption and foster care analysis and reporting system. A significant issue is the plan for states to report data on children in foster care who fall under the protection of the Indian Child Welfare Act. You will hear from Children's Bureau leadership this afternoon on the provisions of the final rule and the timeline for implementation. The Office of Family Assistance recently posted the Tribal TANF Child Welfare Coordination Grant, TTCW, funding opportunity announcement. Applicants are strongly encouraged to propose projects leading to systems changes so that the improvements to the coordination of tribal TANF and child welfare programs are sustained beyond the project period. OFA has also been responsive to emergent needs related to COVID-19. They have issued a program instruction that answers some of the most pressing questions and are planning to issue additional guidance in the near future. I am also pleased to transition this session to Scott Lee Can, ACF's Principal Deputy Assistant Secretary. He serves concurrently as the Commissioner for the Office of Child Support Enforcement. This program office supports 60 tribal child support programs that managed over 59,000 cases and collected just over $56.4 million for tribal children and families in fiscal year 2019. This office is a collaborator with other ACF programs and initiatives that support the financial stability of the families with the goal of self-sufficiency. For example, OCSC and the tribal child support programs collaborate with TANF, Children's Bureau, and with child care. Other collaborative activities include fatherhood initiatives where approximately 30% of tribes participate in fatherhood trainings and programs, supporting the need for both fatherhood and motherhood involvement. OCSC, in collaboration with FVPSA, has provided domestic violence training for caseworkers at 11 tribes with additional training events scheduled. Tribal programs partner with domestic violence shelters and advocacy programs assisting families in need. So with all that said, you're going to hear some really good information in just a few minutes, but I want to ask you all a question that I'm very interested in. As we move forward into the recovery post-COVID, as we start helping move to stronger, healthier areas of our lives, I want to know, what did we do? What flexibilities did we grant under COVID-19 in our response that you think we should keep as we move forward? I believe that there is a way to do human service delivery in a better and stronger way rather than going back to just what was normal. But I need you to guide me and give me information on what worked, what was flexible and good things happened, what was given that made a difference. And we will take those things extremely seriously because we should institutionalize what works. We should simplify what we can, and we should give that ability for you to manage as you move forward so that you can do what's better for your community rather than dictated from the federal government. So give me those answers, share those in the chat, give those to Jeannie, and also, or bring them up after I hang up. But please think about what, I'm going to say it again, what flexibilities granted under COVID-19 response do you feel should remain beyond the pandemic? Thank you again. I always find that these consultations are some of the most favorite things that I do. So thank you, thank you, thank you. And now I'll go on listening mode so I could hear what you have to say. I appreciate all of you.
Thank you, Assistant Secretary. At this time, I would like to ask that tribal leaders get on the call first. If you have any comments or questions at this time, please press *# and you'll be placed in a queue. Please remember to state your name, title, and tribal affiliation for the record before making your comment or question.
We have one in queue.
Hello, can you hear me?
We can hear you. Please
Okay.
go ahead.
Okay. Sagole Swagwake, my name is Jennifer Webster, Councilwoman for the Oneida Nation. And I'm here to talk a little bit about an idea that we have for the future of ACF programs and services. First, I want to thank you for this opportunity, Commissioner Hovland, Lynn Johnson, and for the beautiful blessing, Mr. Tilford Denver. Really appreciate that during this time. I'd like to share a little bit of information from my nation, so it'll take about 3 minutes, my prepared statement, and we'll also be sending this in. Again, Jennifer Webster, Councilwoman for Oneida Nation in Wisconsin. The nation is a Title V self-governance tribe with approximately 17,316 citizens. Our reservation was established in 1838 and covers nearly 65,000 acres located within the boundaries of Brown and Outagamie counties in northeast Wisconsin. So when you fly into Green Bay, you're flying right into the reservation. About 7,872 enrolled members live within the two counties. 57% of those live on the Oneida Reservation. We have a little over 2,000 enrolled members that reside within southeast Wisconsin, mostly the Milwaukee area. The governing body of our nation is the General Tribal Council, who elect and authorize the Oneida Business Committee to oversee tribal operations. The Oneida Business Committee consists of a chairperson, vice chair, secretary, treasurer, 5 council members, each elected to concurrent 3-year terms. The purpose of our inherent right to self-governance is to protect the health, safety, and welfare of our members while protecting our culture, revitalizing our language, restoring the environment to improve the quality of life for our community. We are committed to maintaining our language and culture. Our rich traditions, culture, and language are incorporated into the very fabric of our nation. For nearly 200 years, we have lived in Wisconsin. We have built a community that is proud and dedicated to the good mind, a good heart, and a strong fire. Now that you know a little bit about Oneida Nation, I'd like to share some of our visions for ACF programs and services. First, the Self-Governance Pilot Project. The Oneida Nation supports expanding self-governance into HHS and are willing to actively collaborate with ACF in setting up a self-governance demonstration project. As you may be aware, tribal self-determination and self-governance has been the most successful federal Indian policy in history, and nearly all tribal nations utilize self-determination contracts and/or self-governance compacts and have extensive experience with Title I and Title V of ISDIA. Self-governance allows tribes as sovereign nations to exercise their inherent right to self-govern and accept federal program funds through a negotiated agreement and provide programs and services that meet the needs of our citizens and tribal communities. The growth and success of self-governance within the Department of HHS, IHS, is best documented by the 360 tribes currently participating in self-governance compared to the 14 tribes who signed agreements in 1993 to 1994. Self-governance tribes manage over $2 billion in health care appropriations to IHS each year. In addition, the tribal-federal relationship has improved under this authority, and self-governance has become among the most successful tribal government-to-government policy to exist in history of the United States. HHS concluded in 2003 that a self-governance demonstration project for HHS programs outside of IHS is feasible, and a tribal federal work group provided implementation guidance in 2014. For more than 3 decades, self-governance has shown to be an effective and efficient approach for implementing the government-to-government relationship that exists between the federal government and tribal governments. If ACF funds were provided through self-determination contracts and self-governance agreements, tribal nations would be able to develop a long-term plan to meet the needs of their communities. Tribal nations would also recognize greater flexibility to redesign programs that provide critical social services to their communities. Further, self-governance reduces levels of federal bureaucracy and expands local decision-making and tribal control. The United Nations has been a Title V self-governance tribe since 1997, and we had the great success of doing so. We care for over 14,000 patients at our Comprehensive Health Division and have built and maintained positive relationships with our IHS partners. We have a better understanding of what our community needs and can redesign and administer programs to meet those needs. One benefit that we have experienced with self-governance is that our community holds us accountable in the programs and services that we provide. This has led to the improvement in services, which has resulted in an improvement in health, welfare, and quality of life for our community. In addition, it provides our citizens the ability to build capacity by performing duties and functions that were once performed by non-ONIDA staff. I asked ACF to move forward in the self-governance demonstration project. In closing, please accept these oral comments with my sincere request to work together with ACF in the spirit of partnership and shared interest to govern and protect our children and families. I look forward to continuing the self-governance demonstration project discussion as a decision-making process as it moves forward. I thank you for this opportunity to provide these comments and recommendations and look forward to ACF's response to our requests. I also want to personally thank Commissioner Hovland and her leadership for the past few years. In speaking with our ACF programs and services, I have heard great things on how responsive and supportive ACF has been. Yawanko, and thank you.
Thank you so much for your kind words and also for your request. And we will definitely respond in writing, but also continue to have our dialogue with you as one of our valued Tribal Advisory Committee members as we look at options and all of those that you brought up today. So thank you.
Mm-hmm.
Operator, we are ready to hear from our next tribal leader.
Thank you. We have one more in queue.
Good morning. Can you hear me?
We can hear you. Thank you. Please state your name, title, and tribal affiliation.
Good morning. My name is Vivian Corthius. I serve as the Chief Executive Officer for the Association of Village Council Presidents in Bethel, Alaska. AVCP is a nonprofit tribal organization and a consortium of 56 federally recognized tribes in the YK Delta in western Alaska. AVCP provides governmental and social services to a very large region, comparably to the size of the state of Washington. The AVCP region in rural Alaska is like what I'm referring to as extreme rural America. Over the past several times I've had to give testimony. That's the best way that I can explain what our region is like. We are located off the road system in Alaska, which is has extreme costs of living and limited transportation and technology infrastructure. AVCP provides services at 4 levels. The village level, and we have 48 sites, 48 villages we provide services in. The sub-regional or hub level, and we have 7 of those. And the regional level, the regional hub community of Bethel. And the 4th level of service is we provide services to those tribal members who live out of the region, say in Anchorage or anywhere in the lower 48. So we deliver services to 56 tribes and individual tribal members. We manage a quality improvement process which we started in 2016, and this is really critical for us right now because we are trying to react and manage and plan for COVID-19, and we operate our quality improvement process at all these levels of operation. We provide region-wide tribal advocacy at the state, at tribal gatherings, at the federal government, and other areas. So we speak at many, many different gatherings, and we provide that advocacy continuously for our region's tribes. We also manage major projects for the benefit of our whole region in Western Alaska. We call this model our service delivery model, and we've developed each of those aspects of our service delivery model over the past 4 years. 5 years ago, when we became the Tawahi demonstration site for Alaska and the whole nation as a consortium, we laid the groundwork for a quality improvement process. We initially focused on breaking down the silos between the departments within our organization, and we started restructuring our programs around a service, not a funding source. So we have advanced 5 years into this process, and we are seeing the benefits of that right now. We began this process to provide more services to our tribes at the village level, at the sub-region level, instead of centralizing all those services here in Bethel. And we've done a really good job listening to our region's tribes and individual tribal members and what they vision as those services being in their communities. As we started out with our service delivery model process and the quality improvement project in year 5, COVID-19 happened. That was several months ago. Over the span of just a couple weeks, we transitioned over 90% of our workforce to working remotely. And this is all across our region. In my opinion, if we did not have the designation of a Tawahi demonstration site, or if we did not start the quality improvement process several years ago, we would be in a worse position than we anticipated. For the employees who continued to go to the office, we had to alter office spaces, obtain protective equipment, and increase our vigilance in sanitation. For our remote employees, we struggled with overburdened VPN staff without laptops, some staff without cell phones or personal internet service. And we struggled with just providing personal protective equipment just to have staff work in their homes. We realized that AVCP needed to develop further a new service delivery model that relies heavily on technology in one of Alaska's regions with the least technology infrastructure in place. We are still in need of help to approach this task of figuring out the infrastructure needs and the solutions for our technology as it fits into our service delivery model. We are unable to shut our doors and wait for a vaccine to come because our tribes rely on AVCP to support their operations, and tribal members around our region rely on AVCP for the social safety net, as we have those programs that we deliver throughout our region. Federal government agencies such as ACF can support tribes and tribal organizations by funding the technology infrastructure necessary to continue providing high-quality services to the tribes and communities and tribal members we serve. This investment is necessary because life and business operations have permanently shifted due to COVID-19. Tribes and tribal organizations must shift too. AVCP needs your help as we continue to grow the service delivery model yet again, and we have developed and moved into a new paradigm to be even more flexible to the needs of tribes and still deliver the services to improve the quality of life for our tribes and the YK Delta. Thank you.
Thank you, Vivian, for your comments and your continued advocacy for the Alaska region and villages. And we will follow up with you on each of those items.
Operator, we are ready to hear from our next tribal leader.
Thank you, Chairman. We do have one more in queue.
Good morning.
Good morning. Welcome. Please state your name, title, and tribal affiliation.
Tlitka Senach Will Micklin. In English, I am Will Micklin. Tlinkit Senach Kua, although in Tlingit, Yanyanish. I'm third vice president of the Executive Council for the Central Council of Tlingit Haida Indian Tribes of Alaska. President is Richard J. Peterson, and we operate a number of HHS ACF programs through our self-governance compact or directly or through the state of Alaska as a conduit. We have provided written testimony speaking to our comments and recommendations regarding tribal TANF, tribal family and youth services, in particular the Family First Services Act, the Family Violence Prevention Services Act, child care, and Head Start programs. I just would like to touch on one or two key recommendations, but first I would like to say that describe Central Council. So we are the regional tribe in Southeast Alaska. We are the grandchild of the traditional clans, Tlinkits and Haidas in Southeast Alaska. With the Treaty of Cession in 1867, the clans came together and decided whether to war on the United States or collaborate. We decided to work with the United States. It became problematic with the loss of property and lack of representation. We, in 1912, formed the Alaska Native Brotherhood, in order to better collaborate with the Western society that we had encountered with the United States government. In 1916, we formed the Alaska Native Sisterhood. And in 1929, the A&B and the ANS decided that we needed to protect our rights of Aboriginal title and formed the Central Council of Tlingit Haida Indian Tribes of Alaska as the representative of our Tlingit and Haida tribes in all of Southeast. So we formed in 1929. We filed suit with the United States in 1935. We won the suit in 1958. We had a settlement in 1965 and a distribution in 1968. That created our trust fund that we rely upon today for income for the cost of operating federal and state programs. It was $7 million in 1968, and that's what we rely upon. Also within Southeast Alaska are the other governments in Alaska, the traditional councils and the IRA tribes. So the Indian Reorganization Act of 1934, which was adopted for Alaska in 1936, established tribal associations and tribal cooperatives as in the Kwans or the villages in Southeast. So we today have 17 IRA tribes in Southeast that are also federally recognized tribes, in addition to Central Council. Together, we govern our Tlingit and Haida peoples. Our enrollment at Tlingit and Haida is about 32,000 tribal citizens, and we extend from Yakutat in the north to Heidelberg in the south. With that, I just wanted to say that we greatly appreciate our relationship with HHS and ACF. Those programs that I mentioned are among our largest programs, social services programs, that we utilize to help improve the general welfare of our citizens and to address problems that are appropriate to specific programs that are offered through ACF. Our relationship with ACF and HHS is among the best that we have among federal agencies. For that, I thank you, and I thank the high quality of individuals from Ms. Hovland to Ms. Ekafy to the secretaries that have sat in the position of HHS secretary. So Colonel Chish and Hawa for our continued and always improving relationship. I do wish to mention the impact of the COVID-19. It has been fortunately to date spared us because of our great efforts for in containment. We are still at phase 1 in with Central Council, and other communities in Southeast continue with the fullest measures for containment and suppression to the point of meeting unwanted visitors with at the ports and the airports. Many of our villages are accessed only by marine ferry, barge, or a small plane or float plane. With that, brings to mind the similar impact that the Spanish flu of 1918 had, and really 1919 had on our communities. My grandmother taught me the names of our relatives who passed in 1919, mostly young children and elderly people. As a result of this, that was a great ordeal for our community, but it was a succession from other outbreaks, including the 1912 diphtheria outbreak that decimated our communities. The state of Alaska estimates that we experienced nearly 3,000 deaths between 1918 and 1919, that Alaska experienced more people died in Alaska from the Spanish flu than anywhere else in the world other than Samoa, and that approximately 8% of our population passed on from the effects of that pandemic. We are intent on not repeating this. We are concerned that we, as in 1918, 1919, because of our rural and remote communities, we fare well in the early stages of the pandemic, but in the later stages, in the second phase, we get hit the hardest. And because of our comorbidity factors, our density of our rural communities, and our lack of access to social and healthcare services, and high cost of providing that access, we fare poorly in those outcomes. So we are doing our best to prevent that, and we thank ACF and HHS overall for helping us with managing this this outbreak as best we can. There's a number of things. I've been on the staff as 2 terms as a at-large delegate, 2 terms as a alternate for at-large, and my experience with STAC has been the best among tribal consultation entities collaborating with a federal department. I thank you for that. Just the few comments that I do wish to pull out from our written testimony is one is on the under Tribal Family and Youth Services for AFCARs. ICWA is an enormous hurt on us, what has transpired with ICWA over the many years and the ongoing litigation that attempts to deny us the protections, the few protections that we have to safeguard our children and retain custody over our tribal children and not have them sent out to what is really a commercial enterprise in marketing indigenous children to families that are willing to pay. We worked hard with STAT in prior administration to improve the AFCAR's data elements. We had a fairly large and robust data element set. The 2016 final rule was reported that, and we were in favor of those data elements that we worked hard to promote. We understand that with the final rule that has been reduced to about 10 data elements. So our specific request is that we begin consultation with ACF on how you intend to implement the new data elements on Native children and families. As you know, there are great differences in tribal and state relations in child welfare and how states, like the state of Alaska, implement the Indian Child Welfare Act and other various federal law provisions related to our Native children and families. We hope to highlight those distinctions in order to make more meaningful and more effective the use of those elements that are expressed in the final rule. And secondly, we are very interested in your ideas on how you might collect information regarding data elements that were eliminated from the 2016 final rule. Our understanding from statements made during the NPRM process was that there may be other ways to capture this data. Some states are capturing this data. California passed state law to capture that additional data. We're in talks with state of Alaska on ways to make meaningful other data. So this is an area where tribal consultation we think is needed to ensure that whatever process may be developed is a good fit for our clients, and our clients are our Native children and families. So that's our twofold request. I'll withhold my other comments for the appropriate time.
Thank you, Councilman Micklin. It's always great to hear from you. Appreciate your continued advocacy for our children and families and our communities. and we'll be able to take a deeper dive into the AFCARs from 3 to 4 Eastern Time when we have Dr. Milner available, and happy to visit with you further on those issues. We look forward to your written testimony and responding to each of the items that you presented today on the phone, as well as what you will be presenting in writing. So thank you. Look forward to continuing to work with you.
Operator, we're ready for the next tribal leader.
Thank you. We have 2 more in queue.
Well, we are going to out of respect and good morning. My name is Michael Chavarria, and I serve as the governor for Santa Clara Pueblo here in New Mexico. In addition to serving as the chairman for the All Pueblo Council of Governors here in New Mexico, which comprises the 19 pueblos, to include the pueblo of Isabel del Sur down in Texas. So thank you for allowing me to address the group this morning. And so as mentioned this morning, the trust responsibility is very important. Again, fulfilling that government's responsibility to the Indian tribes by ensuring the interests of tribal nations, pueblos, and communities are accounted for, especially during this hard, unprecedented time with this pandemic. It is unfortunate that we must conduct our consultation through this mechanism. It is a challenge because many of the Pueblo leaders don't have access to broadband, so that makes it a challenge. And so the responsibility, again, is based on the political status of sovereign tribal nations involved in that government-to-government relationship with the United States. The administration, Congress, federal agencies, and federal officials all serve as a trustee for that federal trust responsibility. So it is their solemn duty to ensure that tribal interests are protected during any action, program, or policy undertaking by government and development. As we talked about, the pandemic response legislation. And so working together on this with my staff, we prepared discussion points. We'll submit our comments for the record. Probably touching off with Head Start, though, is having a culturally relevant curriculum. One of the most significant areas we talk about relevance and education for Indian children is to have language, culture, and history be part of that curriculum, so that education isn't something that is separated from our existence in our community. You know, having to change this negative into a positive, being that we live in multi-generational homes with grandpa, grandma, mom, dad, and the children, now with the stay-at-home orders, and having to protect ourselves from this virus, grandma and grandpa are now teaching our children our table language, teaching them the oral histories that grandpa and grandma were taught, because that's priority. Our native language is priority. Our traditions, culture, and activities revolve around that native language. So it's very important that even at the early Head Start and Head Start, that we incorporate some of these, our histories, our language, to then fully support the future leaders of tomorrow, because they are going to be the future leaders of tomorrow. They might be a governor, they might be a lieutenant, an elected official, they might be a cultural leader. One of these days they'll be a parent. And so it's very critical that we identify all those opportunities for the future. But again, that comes with funding. I know for Head Start, there's a lot of criteria that must be followed. And so I know it's kind of been streamlined over the years, but we continue to have many challenges in implementing these type of opportunities for our children. One of the things I do see right now, though, is students with special needs are highly being impacted due to the disruption in services and lack of face-to-face interaction with the teachers, counselors, and support staff. Families with medical conditions and economic challenges are being compounded, again, increasing the stress and behavioral health within our communities. Children are being shuffled between households to meet the demands of child care. As some parents go back to work. And then the scary part is the possibility of increasing the spread of that COVID-19. A lack of social interaction is impacting the social, emotional well-being of our children in their crucial developmental years. And so it is a challenge for all of us. How do we get this accomplished? How do we turn this negative into a positive? And I believe that's the whole reason of having these type of sessions, is to really put our collective minds together to figure out what are the solutions to these challenges. Because without a cure or a vaccine, how much longer are we going to be in this situation? And we have the upcoming school year in a couple months. Are we going to be ready? Again, our most critical thing is the life, health, and safety and welfare of our community. But yet, it makes it a challenge for all of us. And so, as I mentioned, part of the emergency, what we're in is the emergency infrastructure funding to establish broadband capabilities for teleeducation to ensure children continue to achieve academically during this crisis. Without this, our community simply does not have the capacity to implement distance learning. Our schools face the heart-rending choice of exposing our children to risk in the classroom or foregoing teacher-led education during school closures. So how do we get that accomplished? And I know it's going to be having to be discussed at the federal level, but also at the local level. And having those discussions is very warranted at this time. You know, Santa Clara Pueblo has successfully operated a Head Start program for several decades and commenced home-based early Head Start services in recent years. While a goal of Head Start is to move families out of poverty, this definition is not adequate to meet the continued need for educational equality and the trust responsibility of the federal government to the Pueblos of New Mexico. While the federal government continues to push for equality, this does not address the symptomatic oppression of Native Americans through federal policy and does not move towards equality to diminish that achievement gap. And so that's very important of how do we address education for our future. Again, understanding and working through Congress through the various policies and procedures that are being established is very critical. And so as I mentioned, it is unfortunate that we hold these type of sessions. It's really to have a face-to-face meeting, which I consider that as true consultation. However, all of our lives have now changed in 2020 dealing with this unprecedented time of this COVID-19 pandemic. And so the power of prayer, maintaining that daily belief and guidance is very critical, because I do see the challenges of child abuse, elder abuse, again, the missing and murdered women of our Native American communities. You know, for us, Native Americans, we have no criminal jurisdiction over the non-Indians that commit these type of crimes. And many of us have opted into the violence against women to try to undertake some of those jurisdictions back to protect our people, our children, our moms, our sisters, our daughters from murder, sexual abuse, kidnapping, serious bodily assault. And so that's also very important. And we continue to advocate for the Violence Against Women Act. That's very important. So it's very critical that we get any reauthorization to Congress squared up to now include the children and the law enforcement personnel, because the original act doesn't include, it's only the intimate partner relationship that we can take advantage of, but now the children are seeing that violence firsthand. And then when our law enforcement show up to assist, they're assaulted. And so it's very important that we work together with our Bureau of Indian Affairs, Office of Justice Services, through our U.S. Attorney's Office, through our local law enforcement and tribal courts, which is very important to get that accomplished, again, to protect our life, safety, and welfare of our communities. I don't have many other issues that my staff has addressed. I don't have enough time. I'd like to have other tribal leaders to express their viewpoints. And so we will be submitting our written comments within the next couple of days. I know there was a couple of questions that were posed in the beginning of what has worked during this time, what do we like to see to maintain that status quo. And so as we listen to the rest of the conversation today, we'll listen to the questions that are being posed and impose some possible responses as we see fit, not just for Santa Clara, but also the All Pueblo Council of Governors, the 19 pueblos here in New Mexico. Again, again, thank you very much, and may the Creator help each and every one of you to remain strong, remain vigilant for our children, for our people, and for all of us during this unprecedented time of this COVID-19. So again, thank you for the time and opportunity.
Pidamaye, Governor Shavaria, thank you so much. And I know we have a lot of folks on the line and we need to move on. I just want to, say quickly, what you brought up, and Councilman Micklin, talking about how can we address the inequity that we have in our communities when it comes to health, education, economics. It's something that COVID has really brought to the national light. And there's been a response nationally, and I know there's need for more. But if working with Admiral Wiaki, we need to see how we can continue to move forward from where we are with the COVID-19 and addressing these inequities. And instead of moving back afterwards, but helping our community to be stronger and more prepared. So thank you. Look forward to what you submit in writing, and we will respond to each item that you have brought up here today. Thank you again.
Thank you all. This next comment will be the last comment of this session. You can add additional comments in the chat box, as well as send additional testimony in writing for any comments or testimony we did not hear today. So operator, it's the next commenter.
Ike Squatchy, this is Lonnie Greninger, Vice Chairwoman for the Jamestown Squalum Tribe. Can everyone hear me?
We can hear you. Thank you.
Great, thank you. I just wanted to give a few brief comments in response to Assistant Secretary Johnson's two-part question on what flexibilities have been helpful to us, and then, what flexibility should we carry on in the response of recovery to COVID. And I want to respond to the first half of that, as I haven't wrapped my head around the second piece of that yet. But some of the flexibilities, especially around our CCDF grants that have been very helpful to us, is the additional funding that was provided. We were able to gather supplies for a lot of different activity kits to keep our children and our youth engaged. I'm sure many of our tribes have heard this. A lot of our children have been struggling a lot because they've lost any semblance of structure and pattern, and that has a lot of feelings of security for our children, and they've lost that when they were taken out of school. We have been able to use this extra funding to keep our kids engaged and giving them some sort of semblance of security through continued engagement and structure. And you're going to have program with us on Tuesdays, Thursdays, and Fridays, and they actually look forward to that. So we're very grateful for that piece of it. We've been able to, like I said earlier, use our funding for activity kits. So while these kids are doing activities with their hands, we are also able to discuss with them, what does it mean to cope in the midst of these uncertain times? How do you, as a child or a youth, how do you describe your feelings so that you can get them out and they don't burn inside of you? So we've been very grateful for that. We've also been able to purchase just a handful of notebooks to loan out to our youth so they can connect to our program through the Zoom virtual platform. We are super appreciative of allowing payment to staff even when tribally operated centers had to close. When we closed, we were still able to pay our staff to sanitize and clean our buildings and our transport vehicles, so we're very grateful for that. We were able to do continued payments and assistance to our local child care providers so they could stay open. We were able to support our local community. We appreciated exemptions from the quality and direct service spending requirements. We appreciated flexibility on the dates of obligation and liquidating funds. We appreciated the discretionary tribal set-aside percentage was increased from 2% to 2.75 for this fiscal year. And we also appreciated the flexibility to define which of our workers were essential according to our policies. We didn't have to use anyone else's. We could define it in our own way. So those are the flexibilities for CCDF. And then also just adding a quick plug for LIHEAP. We appreciated the extra funds that we were able to receive from ACF for that particular program, excuse me, and we were able to support families with extra energy assistance who have been laid off for more than 2 months and sometimes continue to be laid off right now. Even in the midst of our Washington State stay-at-home orders, they're starting to loosen up, but some folks are still without a job. So thank you for allowing me to make those brief comments, and I will submit more through written testimony. Thank you.
Thank you, Lonnie. Always great to hear from you, and we will look forward to your written comment.
Thank you to the Assistant Secretary Johnson and to all those that provided comments during the session. Hottenson, Steicha, thank you, friends and family. We will now begin our consultation session on child support enforcement with ACF Principal Deputy Assistant Secretary Scott Leakin and Director of Division of Regional Operations of OCSE, Melissa Johnson.
Good afternoon, and thank you for joining us today to share your perspectives and impacts of the Tribal Child Support Program on your tribes. As mentioned, my name is Scott Leakin, and I currently serve as the Acting Commissioner for the Office of Child Support Enforcement. And then, as I say, my day job is the Principal Deputy Assistant Secretary for the Administration for Children and Families. I'm really excited to be here today, and I am so glad that we have an opportunity to discuss concerns and or thankfulness to both sides of the program, not only the Tribal Child Support Program, but the federal office in helping move people to self-sufficiency. So I know earlier Assistant Secretary Lynn Johnson provided some statistical data on the Tribal Child Support Program, as well as some highlights on the collaboration efforts that have been occurring between ACF and the tribal communities and within the tribal communities. I continue to hear of all the amazing initiatives and programs that the tribal communities are working on, and as we work together towards moving parents towards family self-sufficiency, I know that we are making strides, but we do have some continued work that we need to do. And as we discuss further today, I do want to hear from you more about the ideas on how we continue this work. And we know, and I say this emphatically, that you know how best to serve your families in your communities, and we do not have all the answers. We can help point you in some directions of best practices, but we know that we need to allow you to be able to serve your communities most effectively. I'm really happy and kind of excited to report that we recently issued, OCSE did, a funding announcement available to states and tribes on charting a course for economic mobility and responsible parenting. This grant project will leverage the Child Support Program's responsible parenting expertise to educate and motivate teens and young adults to postpone parenthood until after their education, starting a career, and having a committed relationship. Be sure to visit our website, and the information's on our grants.gov. That's where you also apply. And I know this is a short time period, but the applications are due June 29th, and I encourage each of you to apply. This is a great opportunity to get some money that you can leverage in your communities to work on responsible parenting and economic mobility for the young folks in your tribes and in communities that surround as well. I do want to say and echo, I know that the COVID-19 pandemic has really impacted communities across the board and some of the tribes more directly and impactfully than some of the other areas. So I do want to take a few minutes and just talk about some flexibilities that the Office of Child Support Enforcement has issued and related to the COVID-19 pandemic. We recently issued some guidance on applying for a waiver of the non-federal share requirement for your current fiscal year 2020 grant award and upcoming 2021 funding. We are offering flexibility for emergency waiver applications on the regulatory requirement for a tribe to demonstrate that it attempted to attain financial assistance from other programs or entities. And given the pandemic, we are not requiring that documentation. For the emergency waivers, we will also accept a letter or a statement of assurance that the tribe regarding the funding shortfall, and that is not just affecting the child support program, but other programs as well. So I encourage you, if you are a manager of a tribal child support program, to reach out to your regional program specialist if you need additional information or guidance to apply for a waiver. We are really trying to be as flexible as we can with this, because we know that a lot of the money that would normally have been provided as part of the tribal share for the program may have been diverted to this major health crisis, and we understand that and want to provide you an opportunity to have flexibility and utilize the funds as you see fit during this pandemic. And one of the other things is, lastly, as a note before I open it up to the floor to talk about some things, I wanted to address some input we received during the 2019 ACF Tribal Consultation, where child support was discussed at length. We know that over 20 tribes participated in the consultation session in California, providing oral testimony, and we did receive additional testimony through written means from several of the tribes. The topics of last year's consultation session centered around the non-federal share requirement and the inability of tribes to claim fair market value of donated space. I want to summarize those discussions and our response to those at this point in time. So regarding the non-federal share, the current non-federal share of the program expenditures is 10% during the first 3 years of comprehensive child support program operation and 20% for every year thereafter. There is no non-federal share during the startup period of a program. Thus, startup expenses are paid at 100% by the federal government, up to $500,000 for a 2-year period. We do recognize that the 20% non-federal share has been difficult for some tribes to meet, and thus have approved waivers of portions of the non-federal share as authorized through 45 CFR 309.130, which is our regulation allowing waiver during certain circumstances, which the COVID-19 pandemic fits into that at this point in time. So if we were to look at this from a global perspective and change the non-federal share, it would require opening and revising the federal regulations. We would not be permitted to do regulation change without public comment, so no interim final rule or direct final rule will be issued. I want you to understand that any proposed regulatory change would still be reviewed by the Office of Management and Budget and/or Congress, who could raise concerns or delay processing or block any increases to the federal share. This is just a note to say that there are processes outside of what ACF has the authority to do at this point in time. The child support regulations do allow, and I'm going to emphasize this again, to request a waiver of their non-federal share both in an emergency situation and an anticipated situation. So if your tribe is struggling to meet the non-federal share, I encourage you to review the regulations and reach out to your regional program specialist for guidance on how to apply for a waiver of non-federal share. The waivers are the only avenue right now for a reduced non-federal share at this time. The last topic that was discussed at the consultation in 2019 was on fair market value of rental or donated space of tribally owned buildings. So we understand that the inability to count the fair market value of the rental or donated space of a tribally owned building impacts tribes' ability to meet their non-federal share. The regulations governing this requirement are part of the universal cost principles. They are not directly part of the tribal child support program regulations. What this means is that it applies to all of our HHS programs: Head Start, Child Care, Children's Bureau, and TANF. A change of these regulations will cause a change across all the programs and is broader than the child support program regulations. Therefore, at this point, ACF's review of these cost principles has determined that the tribes may not claim the fair market value of rental or donated space of tribally owned buildings. tribes may continue to claim depreciation, insurance, and maintenance of these spaces. And as we are formulating additional clarification on this guidance, we will be issuing that once it's complete and cleared through the agency. I will pause there and ask if my colleague Melissa Johnson would like to add any additional points to that before we open it up to all of you. Melissa?
Thank you, Scott. I'm honored to be present today, and I appreciate being here as I was back in September as well with all of the tribal representatives. I do not have any additional information for what you've shared, Scott, so I think we're ready to take testimony and any questions or concerns that might be raised by the group.
Thank you, Melissa.
Thank you, operator. Before we get started with tribal leadership, I myself as a tribal leader would like to make a couple of comments, and I don't think it'll be any surprise. From Port Gamble-Sklallam's perspective, we started these discussions in 2017 and continued them in 2019, as you had pointed out. We would really like the match to be lowered to 10% in order to alleviate unnecessary administrative burden and undue hardship on the tribe. We'd also like some clarification on the process to receive a waiver of the match rate. And furthermore, we would like to have more open dialogue and conversation with tribes focused on waiver, match reduction, and technical amendment to the regulation. Can you guys give some feedback on that?
Yes. So one of the things that we have been discussing internally, and thank you for that question, is that we are willing to discuss and go to a formal consultation in regards to reducing the match. I think that out of fairness, we are seeing that the pandemic has in itself caused an undue burden, but we know that a number of tribes do have an issue with meeting that 20% match on a regular basis. So that as we move this forward, I think that I would say that if we could get to a point where we could agree to really only open that piece of the consultation, I would be more than willing to work with Commissioner Hovland and move in that direction. I don't think it would be a prudent use of our time or resources to open all of the regulations, but if this is the one that's causing you the most pressure or causing undue hardship, I believe that this is something that I'm more than willing to engage in.
Thank you.
And then,
operator, oh, I'm sorry.
I wanted to have Melissa talk through your second question around guidance on the non-federal share during this time period.
Certainly. We did have a webinar with the Tribal Child Support Directors. I believe it was in early May. I'd have to look back on the exact date. Specifically focused on requesting waivers, and we do have the recording of that session, so we're able to provide that recording to any tribe that might be interested and that was unable to attend the webinar. At this time, for waivers that are coming in as an emergency, we did provide some additional flexibility. So typically, a waiver request of the non-federal share would have to include a statement of the amount that's requested to be waived, a narrative description justifying the circumstances and what's happening for the waiver. So what we've seen with a lot of the ones that have come in as emergencies really have provided the impact of what's happening in your Indian country. A lot of them have included resolutions issued by the Tribal Council, have included the shelter-in-place orders, and those have been used to help justify the needs for the emergency ones. And they may also help justify if there's a need going into fiscal year 2021 as well. You also typically, for a normal one that we call an anticipated waiver that usually comes in with a budget by August 1st every year, you have to include a portion of the tribal budget to demonstrate that there's a funding shortfall and that there's no funds available to meet the non-federal share requirement. During this emergency period, we recognized
that your financial offices may not be available. Your budget's changing by the hour and by the day. And so we waived providing us a full copy or a portion of your tribal budget, and you're just accepting for these emergency ones a statement from the tribal leadership that there is a shortfall that's not just solely attributable to the 4D child support program, but also to the whole tribe, and that there are not sufficient funds to make up that shortfall for the non-federal share. So that is one flexibility that we have communicated to the tribes during this emergency time period. Also, typically, a waiver request should include any other financial documents that support the request. Oftentimes, it may include what the budget is for the child support program. For these emergency ones, what's been really beneficial as far as when I speak about a financial document, it may be your approved budget, and then it may show what you've already spent, so what remains, and if that's what you're asking to be waived. One thing that's also required in the anticipated waivers, which would usually come in on August 1st, is that you usually have to document that you've made other attempts to try to secure those non-federal funds. But during this emergency period, we recognize it's an epidemic that's hitting everyone. There's no one else that you can go to tap in for help with the, securing these additional funds, so we've waived that during these emergency waiver applications. And then just any other documentation that might be necessary that you think would be beneficial to help show us what the impact has been on your tribe and what is the economic condition that's causing the shortfall. So that's just a really brief summary of what's set out in the regulation at 45 CFR 309-130. Again, we are happy to provide the reporting that was done, and if there's additional needs for further webinars and discussions and technical assistance on what we would be looking for in a waiver, we're certainly willing to provide that again.
Thank you both very much. Operator, I would like to ask first if any tribal leaders wish to make comments at this time. Please remember to state your name, title, and tribal affiliation for the record before making your comment, and keep your remarks as brief as possible.
Thank you, Chairman. We have no one in the queue just yet.
If we have no tribal leadership, if we have any participants that would like to make comment or ask questions at this time.
Thank you, Chairman. We have one in queue.
Hi, Will Micklin, Vice President, Central Council on Tlingit Tribes of Alaska. So,
please go ahead.
Yesterday we discussed the waiver process under 45 CFR 1336.50B, and today we're looking at 45 CFR 309.130. So similar comments that there's a number of fairly detailed concerns about the how a tribe evidences the insufficiency of funds, that basically the mechanism for the waiver, the term for the waiver, the time period for the waiver, that this be done 60 days prior to a funding period is problematic for COVID-19. That an emergency, the emergency is in here alluded to under sub E2 as a hurricane or flood that is similar to other federal regulations that refer to emergency situations, by example, to situations that cause physical damage. And obviously a pandemic doesn't have that effect. So I'd say overall, I go back to our longstanding position that the non-federal share is burdensome for tribes. We would never have begun operation of a Title 4E or even 4D program if we had to assume the share. So the 0% on startup is key. But the rise from 10% to 20% is extremely burdensome. Our Title IV programs are among our largest programs that we operate, so the total program cost is significant, and the percentage that we have to put up for our operation of what we view as essential services that are really based upon the federal trust responsibility and government-to-government relationship is, we think, inequitable that we have to assume such a large burden, and the calculation based on the lesser percentage of funded by the government, the federal government, and the program, and what the tribe has to come up in federal share. It just goes, again, the mechanics of the calculation that we can go through in detail is an extreme burden. I am concerned, again, and I'll repeat it, that the requirement to notice before the budget periods or the program periods is a real issue. Right now, the emergency declaration extends only through December 31st. So these are real issues for us. And I really think what we need is a fuller discussion on a more reasonable percentage and a mechanism that has a more reasonable criteria for evidence of need and the time period for filling that need, other than on an emergency basis, which is so truly exceptional that there's some consultation. I do want to add one more thing. I know we're talking about the appeal on this. I do want to talk about our gratitude for ACF under the President's FY 2021 budget recommendations that request an extension of the guidance for tribes directly funded to operate the Title IV program through an agreement with the state, and that would increase the number of excuse me, I lost track here. What I'm speaking to is the commitment to improve the capacity of tribes to provide culturally appropriate services. And so we have two recommendations in here that we further consider adding guidance related to the use of evidence-based prevention services that allows for cultural adaptations of approved evidence-based services, and a related request that for ACF to prioritize discretionary funding so that it's more available to tribes and tribal organizations to conduct research on cultural practices so they become approved evidence-based practices in the future. I emphasize this because COVID-19 has again demonstrated the deficiencies in relying on Western-based practices for our families and youth, and how responsive they are to rich cultural adaptations of these programs and services using our own traditions and practices and ceremonies, whether it's native foods to song and dance to just values. Those are, I think, demonstrable, effective, and meaningful to our communities. And the more we can work with the ACF to make these allowable expenses and a part of the expected program practices, is going to be better for our communities. And this COVID-19 pandemic has only proven our prior positions to us to be on point and helpful to our community. So thank you. I know my speaking directly to the appeal provision, there's just so many points on here. my recommendation is we have some mechanism to consult about how we can make this meaningful. At the same time, tie that to a reduction in the non-federal share. That may be a more extended process, but it is essential if we are to continue to improve our programs and allow more tribes to participate in the program. So thank you very much.
And thank you for those comments. And I do think that as we move forward, and I know that Commissioner Hovland will agree that we do need to have a more broad and maybe cross-programmatic conversation on this, as we know that some of these regulations are, I wouldn't say necessarily contradictory, but very specific in regards to timeframes and waiver authorities based on the individual program authority, whether it's 4D or 4E, and there needs to be some continuity in that. And after hearing, from our original consultation back in 2019, and then again, today, we understand that this is a big concern and this is a burden for all of you on the current non-federal share. And I believe that, as I think through this, and I will consult with Commissioner Hovland a little bit more about maybe an expedited way to do this, where we can get to a resolution that meets everyone's interest. So thank you for that comment.
And if I may just add a sentence, I would really suggest that the emergency provision related to the program be targeted to emergencies in our tribal communities more than climactic or pathogenic emergencies. We truly have significant adversity that are emergencies in our communities, and that we can focus funding based on that evidence, I think would be far more meaningful to our communities. Thank you.
So yeah, so excellent. So like really expanding the definition of the scope for specific to the tribal communities, I think would be extremely beneficial, because you've made some excellent points and observations on the differences between other communities and then the tribal communities. So thank you.
This is Melissa Johnson. If I can add one thing as well. You spoke to the time period and having to request those waivers for the upcoming fiscal year 30 days or 60 days before the fiscal year starts. So those usually do come in around August 1st. When we had our webinar on May 1st with the tribal directors, we did share that, and what we heard on the call from many of the directors was the tribe budget is really not set by August 1 or whenever they're getting their budget approved in June and July in order to know yet if they need the waiver, but they're anticipating because of this pandemic that it's going to be needed. So our guidance at that time was if it's not known at August 1, they could submit their budget as normal. And then at the beginning of the fiscal year, as the tribe finalizes their budget and sees the fiscal impact, they could still submit the emergency waiver under this pandemic and under your disaster that would still be continuing at that time. So if the 60 days in advance of the fiscal year is a problem, we are offering that flexibility that if it's not known yet at that point and you're still experiencing the effects of this disaster, we would accept those waiver requests at the beginning of the fiscal year as well.
Operator, we are ready to hear from the next tribal leader, designee, or participant.
Thank you, Chairman. We have two in queue. Please go ahead.
Good afternoon. I am Donna Hare, and I am a member of the Pawnee Business Council with the Pawnee Nation of Oklahoma. And I wanted to start by acknowledging Lucille Dawson, who had formed a work group in the mid to late 1990s, and it was for tribes to be able to contract and administer their own Office of Child Support programs. I was very fortunate to be a member of that work group, and it took several years for the regs to come out after we completed our work, and some of our tribal provisions that we had, that the work group had put in there didn't come out in the final regs. And so I hope that at some time we can revisit that and look at some of the non-Western based approaches, you know, more of our traditional ways of taking care, fulfilling those child support responsibilities. So that's my comments, and I want to thank you.
Thank you for that suggestion. This is Melissa Johnson again. I think as well, if we're looking at some of the recommendations of the work group, I think that even those recommendations can be updated in this day and age, because I think we're all seeing, as a result of this pandemic, a new way of operating, and how those would need to be taken into consideration as well that may not have been contemplated by that work group.
Yes, thank you.
And thank you, Melissa. I couldn't get off mute.
Operator, we're ready for the next caller.
Thank you, Chairman. We have one more in queue. Please go ahead.
Good afternoon. This is Myrna Thompson, Tribal Secretary for the Sisseton, Wahpeton, Oyate, and Northeastern South Dakota of the Lake Traverse Reservation. And I just wanted to make a couple of comments in regards to the decreased requirements to request a waiver. Would be valuable to keep in place once this pandemic is over. But because we may experience another wave of the pandemic, to consider reducing the matching amount to 10% would be helpful to keep in place. And also, I had a question regarding when someone does apply for a waiver, is it going to be retroactive to March 1st? I was told that it would be only from the date of request. So, thank you.
This is Melissa Johnson again. Thank you for those recommendations. And as to your question about the effective date for the waiver, really that is not necessarily an effective date so much as when you submit it, we're asking that you tell us the amount that you are needing waived. So when you would look at your tribal child support budget, what has been spent and what remains and what your needs are, that would really determine how much you would need to have waived, more so than just looking at a specific date.
Thank you.
So this is Scott Lee again. I want to reiterate what Melissa said. We want to be as flexible as possible on that, and you know best what you need. We know that, you know, with the states, on the flip side with the states, we had to wait for emergency declarations, and then that made a determination on, you know, what they needed flexibility-wise. But because of the difference in the way you operate your tribes and knowing that you may not have, you know, allocated funding directly immediately to the COVID and it's come after the fact and been a reduction in the budget, we just need to know what the amount is so that we have an idea. So we're not asking to say, provide us the date as Melissa said. We don't need that. We just need to know what the need is, understanding that you know, we want to be as flexible with that as possible because we want you to be able to operate and serve your communities in the most efficient and effective way possible. So thank you for bringing those observations up to us.
Operator, we're ready for the next call.
Thank you, Chairman. We have no one in queue at this time. If anyone does have a comment, please press * pound on your phone to enter the queue. We'll give it just one moment.
This is Melissa Johnson. If I can just clarify, because I saw a comment that I was a bit unclear about what I was talking about August 1 versus October 1. If I can clarify that, I would like to do so. So in the regulations, we speak about waivers. There are two types of waivers that are provided for. They're the emergency waivers. So those may happen at any point in a fiscal year, and they can be asked for at that moment. So that's the ones that we call the emergency waivers. And there is another opportunity that also exists for what we call anticipated waivers. And usually that's the Tribal Child Support Program has to submit their anticipated budget for the upcoming fiscal year by August 1. And the regulation requires that if they anticipate that they won't be able to meet the full non-federal share, that at the time they submit that budget submission, that budget estimate on August 1, they would also need to ask for any waiver of their non-federal share for the upcoming fiscal year at that time. So we consider that like an anticipated waiver because we're estimating what's going to happen in the fiscal year. So that's why I was talking about the flexibility for August 1, because we've heard from some of the tribal directors that they may not know for sure how the full picture of the tribal budget looks on August 1. So that's what I'm saying. They can go ahead and submit the budget for the Tribal Child Support Program, but if the tribe doesn't have a picture of the full budget for their tribe at that time, they can then wait to request the emergency waiver after the beginning of the fiscal year once it becomes a little bit more clear as to how this pandemic is playing out rather than the anticipated at this point, because we do recognize that this pandemic is going to be playing out for a longer period of time, and as has been mentioned, whether or not there'll be any surges that might come again. So that's what I was trying to make my distinction between August 1 and October 1. I hope that helps clarify.
Thank you. We have no callers in queue at this time. We have one caller now. Please go ahead. No, it looks like they have dropped.
Lee, this is Commissioner Hovland. If there are others that want to, we have a little bit of time, but a little less than around 25 minutes, 25 minutes. If there are others that wanted to speak on any of the other topics, feel free to go into queue. I'm not sure if Commissioner Darling is available to start the next topic, which was scheduled at 3 p.m. But we do have also some comments we can go through, and then again, if any of you want to speak about a comment from earlier today that you didn't have the opportunity, feel free to go ahead and hit star hashtag.
Commissioner, we do have one in queue now.
Thank you.
Caller, please go ahead and state your name, title, and tribal affiliation.
Hi, good afternoon. This is Karen Returns 4, and I'm with the Northern Rampal Child Support Program. Can you hear me?
We can hear you. Thank you. Please go ahead.
Okay. I'd like some clarification regarding the fair market value. The final rule is, well, I guess my first question would be, is this the final rule from ACF regarding fair market value? And then the other question is, am I correct in hearing Commissioner Leakin saying that this is regulation from the universal cost principles? Could I get clarification on that, please?
This is Scott. I will touch on as much as I can, and then Melissa will fill in the blanks as she's been a little bit more intimately involved in this. So as far as what we would say is a universal cost principle, yes. So it's across all of the programs. So because this is not specific to child support funding, that it encompasses a number of programs, not just within the Administration for Children and Families, but within Health and Human Services as a whole, that it would cause a broad change across all of the programs in the way that we administer the fair market value. So at this point in time, the standard in place is as exists, and that it would just be on how it's interpreted now with the claiming the depreciation, insurance, and maintenance for these spaces. Melissa, is there any details that you've been involved in outside of that?
So yes, I would just clarify that this isn't necessarily a final rule because it's not a new regulation that's been issued. It's just clarifying and interpreting the universal cost principles that are out there. That when an entity such as the tribe owns the building, it's still a tribally owned space. It may not necessarily be owned by the child support program, but it's a tribally owned building. And in those instances, even if the tribal child support program doesn't pay rent to the tribe, it still would qualify as a tribally owned building that would limit the ability to claim those expenses to the depreciation, maintenance, and I believe insurance as we have set out. We do recognize that there have been issues and questions that have been submitted to OCSE specific to this topic, and we're working on some clarifying policy issuances to come out. So please look for that in the coming weeks.
Okay, thank you.
Pardon me. We have 2 more callers in queue. The next caller, please state your name, title, and tribal affiliation.
Good afternoon. This is Gil Vigil, Executive Director for the Northern Indian Pueblos Council, and also former Governor of Chisuki Pueblo and lifetime council member by the virtue of that. And I'm also the president of the National Indian Child Welfare Association. And I know yesterday I gave testimony on tribal early childhood initiatives with our Head Start and child care programs and some of the initiatives we're working on. But also today I want to, since we're asked to comment on other topics, I want to present testimony on behalf of the National Indian Child Welfare Association, which I'm the president of, and that's on AVCARS and the Family First Prevention Service Act. On AVCARS, well, we are disappointed that ACF decided to eliminate the vast majority of data elements from the 2016 final rule. We would like to begin consultation with ACF on how they will implement the new data elements on Native children and families. As you know, there are great differences in tribal and state relations in child welfare and how state implements the Indian Child Welfare Act and other various federal law provisions related to Native children and family. So we'd like to have a consultation on that. We are also interested in your ideas how you might collect information regarding data elements you eliminated from the 2016 final rule based upon statements ACF made during the NPRM process that suggested there may be other ways to capture this data. This is another area where tribal consultation is needed to ensure whatever process may be used to develop is a good fit for Native children and families. And that goes along with the question about tribal sovereignty on information. Yesterday was discussed that, so that could apply to this also. And on the First Family Prevention Service Act, we commend ACF for including a provision in the President's FY 2021 budget recommendation that requests an extension of the guidelines of the guidance for tribes directly funded to operate Title IV-E programs to tribes that are operating the Title IV-E program through an agreement with the state. This would greatly increase the number of tribes that could confidently operate the prevention service portion of Title IV-E and improve the capacity of tribal nations to provide culturally appropriate services, which I talked about yesterday, also being more aware of what the cultural appropriateness is. We would ask that you also further consider adding guidance related to the use of evidence-based prevention services that also allows for cultural adaptations of approved evidence-based services. The process for approving evidence-based prevention service is moving slowly, and the mainstream practices that have been approved so far could be of significant more use if they were guidance that approve cultural adaptations. Another related request is for ACF to prioritize discretionary funding so it is more available for tribes, tribal organizations, and Indian organizations to conduct research on cultural practices so they may become approved evidence-based practices in the future. Many tribes would like to participate in this kind of research and have relationships with universities or organizations with experience in these kind of data collecting. But the discretionary grant process is often not well suited to tribal needs or realities. Consequently, we see very few applications that want to collect data for tribal cultural practices. ACF oversees a number of discretionary grant programs like those under CAPTA that could be used to conduct this type of research if there was a big outreach to Indian County and process that was more user-friendly for tribal applicants. And with that note, 8 Northern, we are working on developing a program where, for lack of better words, we call it decolonizing ourselves. And in our efforts, we're talking about traditional practices in the past that we utilized and we no longer utilize, but bringing those practices back to the work that we're doing. Unfortunately, some of the funding guidelines prohibit us from doing that because there's, again, going back to my comments about standards, rules, and regulations, sometimes there's just too many rules and regulations that determine or dictate to us of how to do the work, and sometimes it doesn't apply to the work that we're doing. So these are some of the concerns that I would like to express also for on behalf of the National Child Welfare Association. Thank you.
Thank you, and this is Commissioner Hovland. Thank you for your comments, and we look forward to following up with you and the importance of research and the benefits of our native languages and our cultures when they're put to practice. I see firsthand the multiple benefits that come out of the ANA funded projects that incorporate our languages and our cultures, and that is something that we are looking forward to sharing. And I agree, the research that is needed to really show the importance and the benefits that come from our identity as who we are as Native peoples and knowing our languages and our culture. So thank you for your comments. We do have the next session, which would be with Commissioner Darling and Dr. Milner, that can get deeper into your concerns and comments that you had in regards to the Family Violence Prevention Services Act, as well as the AFCARs. So that we're going to move into that session in a few moments, and I might have to have you repeat some of your questions, sir, but in the meantime, did we have any other callers on the line that want to discuss either the topics that we've talked to up to this point or anything yesterday? If there's any callers in queue, let's bring them online.
Commissioner Hovland, we have one in queue.
Yes.
Well, the next. Go ahead.
Hi, I'm Deanna Neswagishi, Division of Social Services, Navajo Nation Executive Director.
Hi,
thank you, Hovland, for allowing opening up for additional remarks, and also Assistant Secretary Johnson. And I'm hoping that the Director of Child Care, Shannon Christian, is also on the line. I know this was a discussion yesterday. But during the past 2 years, tribes has seen a boost in federal child care funding, including additional funds from the CARES Act. Tribes received over $489 million during fiscal year 2020 for child care. During the session, the Office of Child Care will hear from tribal leaders about what is happening locally within the tribal care programs. We are interested in how tribes have identified and addressed issues and any barriers encountered. We want to learn how the recent influx of federal child care funds are supporting tribal communities, and if there are additional resources needed from the Office of Child Care. So our first situation report on Navajo Nation Tribal Child Care Program. The Navajo Nation Division of Social Service regulates and runs the tribe's child care program under the Department of Child Care Development. Since the first Navajo Nation executive order in March 2020, all 28 child care centers have closed in order to mitigate the spread of COVID-19. There are also 68 independent child care providers that provide child care for maybe 1 or 2 children. The independent providers are still operating and provide child care service to parents who are identified by their employer as essential. The current executive order is set to expire July 5th, 2020, and the Department of Child Care is working on re-entry plan for the return of staff and children to the child care centers. Now we have 2 issues and barriers identified by the Department of Child Care Development. First one, there has been a significant decrease of reports of abuse and neglect to the Navajo Nation Child Protective Service Program. Navajo Nation Division of Social Services also oversees the nation's Child Protective Service Program. The Child Protective Services reported that there has been a significant decrease of reports of abuse and neglect from the community when compared to quarter 2 and quarter 3. There were 501 reports to Child Protective Services in quarter 2, which runs from January to March of 2020. This quarter, which is not yet complete and runs between April and June 2020, shows that there have only been 273 reports. Navajo Nation Child Protective Services has identified that many of their reports come from teachers and other child care providers. There is a concern for the safety and welfare of all the children who normally would be in the child care center or who would have a safety net that would investigate potential reports of abuse and neglect. With the Navajo Nation stay-at-home order in place, child care providers cannot have the necessary interaction with children and families to ensure the welfare and safety of the children. The second issue and barriers identified is accessibility of cleaning products and personal protective equipment are a barrier to reopening child care centers. The Division of Social Services completed purchase requisition orders for cleaning products and personal protective equipment in March, and it is now the second week of June, and those supplies and equipment have not been received due to this order being on back order. In order to reopen every child care center and to take necessary safety measures to protect children, families, and staff from the spread of COVID-19, the Department of Child Care Development must have the cleaning products available to conduct deep cleaning of every facility and to maintain sanitation of every center throughout every operating day. The Department of Child Care Development would like to equip every staff member, parent, and child 2 years of age or older for the reopening plan. Without this measure, the Department of Child Care Development will not be able to ensure the safety and welfare of the families and staff. Now, regarding the CARES Act funding for the child care program, the Navajo Nation is appreciative of the CARES Act funding for the child care program. The Department of Child Care Development is utilizing this important funding to equip every independent child care provider with cleaning supplies, personal protective equipment, and other supplies by providing an additional $500 a month for their operation of a safe and healthy child care environment. Lastly, additional resources needed from the Office of Child Care. Virtual training is virtually unrealistic for staff and providers that work on the Navajo Nation. For the operation of child care programs, each provider is required to complete a lengthy list of trainings throughout the year. Staff and providers that work on the Navajo Nation do not have adequate access to the internet nor the technology needed to complete these trainings virtually. Navajo Nation asked the Office of Child Care and the ACF to consider this digital divide when it comes to the completion of the training during this pandemic, as staff normally would be required to leave the Navajo Nation for training in urban cities, which is costly and takes these providers out of the child care center for a total of 20 days annually During this pandemic, it must be recognized that we cannot continue to operate as business as usual. Last comment, similar to the tribal TANF, the Navajo Nation recommends that the Navajo Department of Child Care Development be allowed to secure unobligated funds in reserve accounts without fiscal year limitations for construction of child care centers and increased operating costs resulting from the full implementation of the Child Care Development Block Grant Act of 1990, as amended in 2016 and Section 418 of the Social Security Act. Thank you very much.
Thank you for your comments. I think Jim Henry is on the line. James Henry, if you're speaking, we can't hear you. Operator, are you able to open up the line for James Henry so he can respond?
Commissioner Hovland, we need to get his phone linked to his name. It'll be just one moment. Jim Henry, if you could hit *# on your phone so that we can link you up. Apologies for the delay. It'll be just a moment.
I apologize for our technical difficulties. We're not able to get Mr. James Henry, who's with the Office of Child Care. He was planning to respond, and I apologize. And for the sake of time, we do have about 4 minutes left. He is dialing in. If you can just bear with us a moment. Since we do have a few minutes, we will see if he can respond to some of your comments. Thank you. There will be a moment of silence here while he dials in. I'm not seeing his phone connecting, and I think what we might do is move on to our next item of consultation, and we can have Jim try to respond if we have some time at the end of this next session, and my apologies for that. It's great that we're able to do consultation virtually, but these are some of the glitches that we run into. I'm going to go ahead and move on to our next session. Thank you, everybody, for your last comments. I have the pleasure now to introduce Commissioner Darling. It's important, and I know she understands this, how important it is to uphold the government-to-government trust relationship through our consultations with you and our tribal leaders annually, especially on these essential programs. I very much appreciate the robust contributions that we've received in the last 2 days, and we want to continue on with our consultation with the Administration for Youth and Families, which includes essential offices such as the Children's Bureau and the Family Youth Services Bureau. And I'm going to go ahead and turn things over now to ACYF Commissioner Elizabeth Darling.
Good afternoon or good morning, as it may apply to wherever you are. Are you able to hear me okay?
Yes, we can hear you. Thank you.
Great. I will be talking to you primarily about the Family Prevention and Services Act programs, our domestic violence programs, and appreciate very much all of the information that you have continued to send to us so that we can be made aware of the challenges particularly experienced during the COVID-19 pandemic. We know that individuals, communities, and programs are facing a number of challenges above and beyond those that we face and that you face day to day. So throughout this time, the Family Violence Prevention and Services Program has worked diligently, first of all, to release the CARES Act supplemental funding to tribes and tribal organizations. FIPSA, which I'll use as an abbreviation for Family Violence Prevention Services, has continued close communications with grantees to learn more about and to uplift the issues that tribes are facing nationally, and to provide training and technical assistance directly and through the National Indigenous Women's Resource Center, the Alaska Native Women's Resource Center, and the Strong Hearts Native Helpline. Regarding FIPSA's tribal consultation, I'll provide for you today an overview of what we've learned from the tribes about the challenges of providing domestic violence shelter and services during the pandemic. And I'll also share with you an overview of the training and technical assistance provided to many of the tribes through our funded resource centers. The Family Violence Prevention and Services Act funding provides services to prevent family violence, domestic violence, and dating violence. It also provides immediate shelter and support services for adult and youth victims. And we know that, unfortunately, COVID-19 has exacerbated the issues that were already a harsh reality in many locations. So I have some questions that I would respectfully ask you to be considering as I share some information with you. Two questions in particular that I'd like for you to be thinking about. What are the most pressing emergency shelter and temporary housing issues for families that are experiencing domestic violence during this pandemic? And what are your training and technical assistance needs related to continuing domestic violence shelter and services during this pandemic? So what we've learned so far from you with the help of the Strong Hearts Native Helpline and the National Indigenous Women's Resource Center, as well as the Alaska Native Women's Resource Center, is that overall Native victims of domestic violence do not feel safe, sometimes even to call a helpline. The travel bans from one village to the next often eliminate shelter options for victims needing to go to another village or reservation for shelter. And there are no shelter or safe home options in many rural and remote areas. These issues have, of course, made it more difficult to ensure the safety of victims of domestic violence and has brought to the forefront the need for emergency plans and policies within a community and between communities. Tribes and tribal programs have also reported that most shelters are at capacity. Most survivors in shelter are staying there through the pandemic, which means less access for new clients. There are direct connectivity issues. As programs are using telework or reduced work schedules, advocates are reaching out and answering machines are full. While programs may be open and operating, it's very difficult to reach them. Another impact is on direct services, transportation, emergency financial assistance, and food assistance. Without workers in the office, access is extremely limited. Third is the ability to access substance abuse and mental health services, which is impacted as well. Fourth, unfortunately, stalking incidents have increased, and survivors wanting to leave their state are unable to do so because of travel restrictions. Another is that working remotely has, of course, impacted face-to-face contact with survivors. COVID is causing advocates, in many instances, to be furloughed. Several shelters have been closed, and advocates have been unable to get stay-away orders processed because of closures. IT systems have been stressed, with some tribes having the capabilities to connect and others not having strong IT systems or connectivity. working remotely and what that means in terms of confidentiality for serving survivors over the phone and the internet, and survivor children needing laptops for schooling for those children that are in shelters. I'd like to tell you a little bit about the FIPSA CARES Act supplemental funding to our formula grantees. To help domestic violence programs address many of these COVID-related needs, we released $45 million in CARES Act supplemental funding to states, tribes, and state domestic violence coalitions on May the 11th to provide temporary housing, assistance, and supportive services to victims of family and domestic and dating violence. The award amounts were determined in accordance to the law. Abbreviated application materials will soon be due on June the 30th. 77.5% of those funds went to state, 10% to tribes and tribal organizations, and 10% to state domestic violence coalitions. The funding charts for all of the CARES Act supplementals and all other COVID-19 communications and materials that were sent out to our FIPSA tribal grantees can be found on our website. In addition to the $45 million CARES Act supplemental funding to tribes and tribal organizations, including Alaska Natives, the FIPSA program will soon release $15,675,000 in non-competitive awards to 141 tribal grantees, reaching 253 tribes through the FIPSA appropriation, and $7 million through the Consolidated Act. In addition to the formula grants to tribes, for 2020, the FIPSA program will award $1,400,000 to the National Indigenous Women's Resource Center through a non-competitive continuation, and $1 million will be awarded to the Alaska Resource Center through a competitive grant process. The total amount awarded to tribes and tribal organizations in FY 2020 outside of the CARES Act funding is $30,075,000. FIPSA CARES Act supplemental funding also is being received $2 million in supplemental to the National Domestic Violence Hotline. And the Strong Hearts Native Helpline was allocated 25% or $500,000 of that appropriation. The Strong Hearts Native Helpline, as many of you know, is a culturally appropriate, anonymous, confidential service dedicated to serving Native American survivors of domestic violence and dating violence. I'd like to turn for a moment to our training and technical assistance. There are frequently asked questions on that were developed in response to domestic violence program questions regarding the allowable use of funds for addressing basic needs, including providing rental assistance, hotel, motel, utilities, and moving costs for domestic violence survivors and their children. The document was provided to states, tribes, and state domestic violence coalitions on March 31st through the listserv. The document will be periodically updated and can be found also on our acf.hhs.gov/FYSB website. The National Indigenous Women's Resource Center, from April through May this year, engaged tribes and tribal programs nationally in 4 conversations with the field. The platform is used to learn what COVID-related issues tribes and tribal programs are facing, what support is needed, and what practices are working well to ensure the safety of Native victims of domestic violence and their dependents. A summary of those conversations will be available soon on the website. In addition to the policy-focused one-on-one TA to tribes and tribal communities, the National Indigenous Women's Resource Center is preparing to host 2 survivor-centered training and technical assistance webinars. One will be in June and one will be in July. In June is the trauma-informed advocacy in the time of a pandemic, and in July safety of domestic survivors through a pandemic. Additional webinars and training materials can be found at the National Indigenous Women's Resource Center.org. The Alaska Native Women's Resource Center has been participating in the conversations with the field and providing one-on-one TA to villages and individuals on policy development and disaster planning. They also participate in weekly calls with state and domestic violence coalitions and other constituents to stay abreast of the issues within each state. The Strong Hearts Native Helpline was created by and for Native Americans. As we know, unfortunately, some of the highest rates of domestic violence are in these populations. And the Strong Hearts Helpline has continued to offer services during COVID-19 as the only national crisis helpline for Native Americans. As a result of the issues shared earlier and the increase in the number of callers who identify as repeat callers needing to connect with advocates for ongoing peer support and not having local access, advocates are relying heavily upon safety planning, peer support, and wellness activities with their contacts. The Strong Hearts Native Helpline also implemented chat services toward the end of May. In closing, the Administration on Children, Youth, and Families and the Family and Youth Services Bureau, and particularly the Family Violence Prevention and Services Program, continue to monitor the situation in tribal communities to identify ways the agency can help and to publish any additional information pertaining to the Public Health Emergency Declaration. I would like to thank you so much for allowing me this time for a presentation. I have subject matter experts, my colleague, Associate Commissioner Debbie Powell from the Family Youth Services Bureau, Shondell Dawson from FIPSA, and Indra Kia also available to answer some of your questions. So we look forward to hearing from you.
Thank you, Commissioner Darling. This is Jeremy Sullivan of the Port Gamble S'Klallam Tribe. Before we get started with other comments from tribal leadership, I just wanted to extend our gratitude from the Port Gamble S'Klallam Tribe with our working with our federal partners here. And I really want to thank you for the work providing Title IV E-tribes the flexibility to work on tribally appropriate preventive practices. I also want to let you know that we are going to provide written comments with suggestions about practice-based evidence. So I just want to really let you know that we really appreciate all your work that you're doing. Operator, I'd like to ask first if any, yes, thank you. I'd like to ask that if any first tribal leadership would like to make any comments at this time, please remember to state your name, title, and tribal affiliation for the record before making your comment.
Thank you, Chairman. At this time, we do not have any in queue. We'll wait just one moment. If tribal leaders would like to, oh, we have one in queue. The next caller, please state your name, title, and tribal affiliation, and give your testimony.
Will Micklin, Third Vice President, Executive Council, Central Council, Klickitat Tribes of Alaska. Richard J. Peterson, President for the Regional Tribe for Southeast Alaska. So my comments are simply to commend you for the summary just given that accurately depicts the current state of our concerns about the prevention of violence against women and children in our communities, that accurately depicts the rise in both reports and known instances but unreported events of abuse and neglect that is itself associated with other societal ills in our communities, like substance abuse and child abuse and suicides. We continue to have impacts with opioid abuse and other factors. So thank you for that accurate depiction. I do wish to raise an issue. This Central Council has been intensively involved in these issues on protection of prevention of violence against women and children, with protection for our families and children. Our Chief Justice, Michelle Demert, has been a vocal national advocate in this effort. Our Vice President, one of our Vice Presidents on Executive Council, Catherine Edwards, has been active on these subject matter. And we've, of course, been through our various programmatic staff intensively applying the opportunity to apply these programs to our communities for the benefit of our constituents. I do wish to make a specific note of concern about the Family Violence Prevention Services grants. Clinton-Hyda's FY18 and 19 funding levels under the Family Violence Services and Prevention Act has been drastically reduced from previous years. Reduction over the past 2 years has severely impacted our delivery of these critically needed services to Native family violence victims within Southeast Alaska. Since 2005, 15 years, Clinton-Hyda has received on average annual funding award of $209,000 for the FEPSA services. We've used these funds minimally for staff support and training, and mostly directly for benefits or programs that benefit our Native family violence victims. We've used these towards emergent services, including 3 women's shelters in Southeast. For nearly a decade, Clinton-Hyda supported through MOUs and subrecipient grants, Aware of Juneau, Wish of Ketchikan, and Safe of Sitka. But without proper funding, these shelters are severely impacted on their ability to deliver services, and some are in danger of ceasing to function. We're concerned at the funding reduction in the FEPSA grant awards, specifically over the past 2 years. In FY18, Clinton-Hyda received $170,000, reduction of funding of roughly $38,000, and in FY19, Clinton-Hyda has received thus far only $45,000 to support our community families against violence programs. That's a significant reduction from FY18, and it's increasingly difficult, if not impossible, to deliver even a rudimentary level of services to family violence victims within the tribe's service area, Southeast Alaska. We request a detailed explanation of the method and rationale that ACF uses to formulate the FVPSA funding levels to arrive at these drastically reduced funding amounts. We are in dire need, but we don't have the resources to continue our level of effort as our tribal citizens expect. We strongly request ACF's consideration to restore the funding level for FVPSA to Clinton-Hyda for FY19 to the average level over 15 years of at least $209,000. These are crucial in providing critical emergency and shelter services. This is an urgent matter, especially with the impact of COVID-19 and those victims who have and may need these services. I appreciate the opportunity to comment. Thank you very much, and these are included in our written comments.
Thank you so much, and this is Commissioner Garland. We will get you a detailed explanation about those funding levels in follow-up to your remarks.
Operator,
okay. No, go ahead.
Hi, you guys can hear me now?
We can hear you.
Yes.
Name, title, and
wonderful. Thank you. My name is Nigel Lawrence, Tribal Council, Suquamish Tribal Council Secretary and Director of our Marion Forsman Boucher Early Learning Center. Again, I'd like to thank you all for putting these on, and I'd like to thank all the tribal leaders and staff that are able to join these calls, and I learned so much from being able to listen to you all, and I appreciate it. I asked my Tribal Child Welfare Director about what things she would want me to represent, and her 2 points that first came to mind were, we need more support for tribal child welfare placements who need specialized care. I take this to mean when, children are removed from families and are placed with somebody else, hopefully, following Indian Child Welfare Act, right? Some of those have very specialized care, whether it's learning disabilities or born drug addicted, et cetera. And there's not a lot of families are able or willing to take in kids who need specialized care. And there's a lot of training, a lot of support needed there. The second thing is she would like to have additional access to family to add a note to shared cases. Right now, we only have viewing access. And I don't exactly know what that means, but I wanted that to be added in the record. While I was listening to others speak, one of the things that came to mind about tribal child placements is a lot of these placements are because of drugs and alcohol addiction issues. And the war on drugs has not been working. I know this is more than just the topic today, more than just the people on this call, but we all know the war on drugs is not working. And me, as an individual council person, I'm ready to ask our tribal council to decriminalize all drugs. Stealing to support your addict should still be illegal. Hurting your family, demolishing things should still be, those should still be crimes, but the act of, drugs themselves, we should be actually treating like a disease. People should be in a hospital, in a medical care facility to get that taken care of. Other countries are doing it, other places around the world are doing it and having a lot of success. These are our members. These are our young parents who were raised in drug and alcohol addiction and are fulfilling that cycle. There are members, there are people, and throwing them in jail, sending them to treatment over and over, taking their kids away, tearing apart the family is not what's been working. And how do we help our family, our people, our families get through this? And decriminalizing seems like something that we need to look at. And so I don't know if I'm asking ACF, ACYF to look into this, if I'm asking the Congress to, change laws to the narcotic schedule, all of that. But that's just something that I'm sure has impacted every single one of our communities. And we can all talk about our family members and friends that this has impacted. Thank you very much.
Thank you so much for your comments. And this is Commissioner Hovland from Administration for Native Americans. And while this really crosses over into the substance abuse, SAMHSA, I'm trying to go to the SAMHSA administration as well as Indian Health Service, who have the funding that oftentimes our tribes run our drug and alcohol programs. I chair the Interdepartmental Council on Native American Affairs, and Admiral Wiyaki is the vice chair. So these are comments that we will get to HHS on a whole to see, how can we be looking at these issues across HHS. So thank you for sharing that. I absolutely agree with you that we need to find ways that are effective to help our family members that struggle with substance abuse. So thank you for your comments, and we will follow up on that.
Good afternoon. This is Gil Vigil, Executive Director of the 8 Northern Indian Pueblos Council and former Governor of Suzuki Pueblo and lifetime council member, and also President of the National Indian Child Welfare Association. And Commissioner Darling, I don't know if you were on the line earlier when I made my testimony on behalf of NICWA, but Deputy Secretary Holland suggested that I make this statement again on AVCARS and First Family Prevention Services. So if you weren't on the call, I'll go ahead and do that at this time. So on AVCARS, while we we are disappointed that ACF decided to eliminate the vast majority of data elements for the 2016 final rule. We would like to begin consultation with ACF on how they will implement the new data elements on Native children and families. As you know, there are great differences in tribal and state relations in child welfare and how states implement the Indian Child Welfare Act and other various federal law provisions related to Native children and families. We are also interested in your ideas of how you might collect information regarding data elements you eliminated from the 2016 final rule based on statements ACF made during the NPRM process that suggested there may be other ways to capture this data. This is another area where tribal consultation is needed to ensure whatever process may be developed is a good fit for Native children and families. On the Family First Prevention Services, we commend ACF for including a provision in the President's FY 2021 budget recommendations to request an extension of the guidance for tribes directly funded under to operate the Title 4E program to tribes that are operating Title 4E programs through an agreement with the state. This would greatly increase the number of tribes that could confidently operate the prevention service portion of Title 4E and improve the capacity of tribal nations to provide culturally appropriate services. We would ask that you also further consider adding guidance related to the use of evidence-based prevention service that also allows for cultural adaptations of appropriate evidence-based services. The process for approving evidence-based prevention service is moving slowly, and the mainstream practices that have been approved so far could be significantly more used if there was guidance that proved cultural adaptations. Another related request is that ACF to prioritize discretionary funds so it is more available for tribes, tribal organizations, and Indian organizations to conduct research on cultural practices so they may become approved evidence-based practices in the future. Many tribes would like to participate in this kind of research and have relationships with universities and organizations with experiences in this kind of data collection. But the discretionary grant process is often not too well situated to meet the needs or realities. Consequently, we see very few applicants that want to collect data on tribal cultural practices. ACF oversees a number of discretionary grant programs like those under CAPTA that could be used to conduct this type of research if there was a better outreach to Indian country and a process that was more user-friendly for the tribal applicants. And I also added my personal comments about the work we're doing here at Northern as far as culturally relevant practices and addressing the concerns and some of the issues that are being identified with this consultation, like child abuse, child neglect. In fact, we have our Circles of Life Behavioral Health Network and our Domestic Violence Program Peacekeepers, where we're getting more reports on during this COVID situation. We're getting more reports of domestic violence, child abuse, child neglect because of the stay-home order. A lot of the perpetrators are staying home and are hurting our people. And so we're trying to develop our own traditional methods, and certainly this would also allow us to maybe have our programs to be looked into that and allow us to apply for this kind of funding. So with this, again, I want to thank all of you for having this consultation and hearing our concerns, and I hope that we can, in the future, we can work together to address some of our issues in our communities. Thank you.
Thank you, and we look forward to following up with you regarding your concerns about the Family First Prevention Services Act, as well as the AFCAR's data gathering and the discretionary grant programs.
Yes, and thank you. And David Simmons from our office at NICWA maybe will be contacting you to follow up on this also.
Thank you.
Hi, operator. Just one brief break from these comments. I know we have one more person in the queue, but I want to allow time for Commissioner Darling to do an introduction at this time.
Yes, of course. Go ahead.
It is my pleasure to introduce to you Jerry Milner, the Associate Commissioner for the Children's Bureau. Many of you may recall that over the past 3 years, Jerry has also served as the Acting Commissioner for ACYF, as well as the Acting Associate Commissioner for the Family and Youth Services Bureau, so he's very well versed in all of the programs that are under ACYF. He is passionate about these issues related to child welfare, especially passionate about youth aging out of care, including our Native youth. And Jerry, I'll turn this over to you. Thank you.
Thank you so much, Commissioner. Are folks able to hear me okay?
Yes.
Okay, great. Never quite know. Well, first of all, I'm very honored to be here with you today. I'm joined on the line by a couple of other folks from the Children's Bureau, Joe Bach, who is the Deputy Associate Commissioner for the Children's Bureau, and Gail Collins, who is the Director of our Division of Implementation in the Children's Bureau as well, and they'll have an opportunity to speak just a little bit later. We wanted to bring just a few things to the Tribal Advisory Council today for consultation, and then we're going to also get back to the AFCARS discussion, which I know that so many of you are interested in hearing about. Over the last 3 months, in response to the COVID crisis, we have issued a number of pieces of guidance, encouragement, letters to tribes and states, extending as much flexibility in our child welfare programs as we have been able to extend in order to assist the child welfare programs and also to help ensure that our families and our children get the critical services that they need during this very difficult time. Some of those flexibilities, I'm sure you're probably already aware of them, but have allowed for some different approaches for things like social worker visits with children and families, the use of virtual technology. We have sent letters to the courts, encouraging the courts to continue critical operations during the crisis, also encouraging them to use the flexibilities that come with virtual technology. We've even permitted the use of federal funds to purchase the technology needed where that does not already exist. Some of the flexibilities that we have been able to issue were options that were available to us administratively. Others come about only because we have a national health crisis before us right now. But I think what we would be interested in hearing about is to what extent have the tribes been able to use these flexibilities, and to what benefit have they been able to help children, families, your social services agencies, your courts there. It would be quite helpful to us to have that information as we plan for a post-crisis kind of response to child welfare that, where possible, may include on an ongoing basis some of the flexibilities that we have put put forward out there. So that is one issue that we wanted to bring forward. I think because the second issue that we wanted to raise is somewhat connected to this. I'll go ahead and put it on the table, and then we'll be able to hear back from you on what your thoughts are. Recently, or for quite some time, but more recently during the COVID crisis, we have received requests from states and from tribes for flexibilities in our funding mechanisms that we don't always have the statutory authority to grant because of the way that federal laws are written and govern the use of federal funds and how those funds must be accounted for. For the last 2 years, we have had, as part of the President's budget proposal, what we call a flexible funding option out there, which would allow states and tribes to use their Title IV-E foster care funds for other purposes under Titles IV-E and IV-B, including primary prevention of child abuse and neglect in order to avoid the need for foster care in a number of situations. Unfortunately, those proposals, those budget proposals, have not been picked up in Congress and turned into bills that ultimately could change the funding structure. But we would be very interested in knowing the tribe's reaction to having that kind of flexibility in Title IV-E funding that would allow you to serve families before foster care becomes necessary, ideally before a child is maltreated and put in harm's way. So both of those issues really pertain to more flexibility in how we administer the program and how we fund the programs. And before we get into the AFCARS discussion, I wonder if we might be able to get some reactions, some feedback on those two areas.
Thank you, Commissioner Milner.
Yes. Yes.
Go ahead, Chairman.
Oh, go ahead. Operator, if there's anyone on the line, please let him through.
Thank you. If you have comments, please press * pound to be entered into the queue.
Hi, this is Lonnie Greninger, Vice Chairwoman for the Jamestown Squalum Tribe. Can you hear me?
We can hear you, Lonnie. Please go ahead.
Thank you so much. I would just like to echo the request for consultation regarding the implementation of the new AFCARS, as well as the comments that were made. I want to echo about getting our cultural practices counted in that evidence-based group. And I wonder, I might suggest, see what our ACF TAC members think of this as well, maybe a work group that could help begin this work. You know, we can look into, are there barriers in the larger system that keeps our cultural practices from being counted? Are there places in the system we can work around? Can we find some flexibilities? Things like that. I would also like to just do a quick comment on data accuracy and consistency. As I've just been hearing some of the comments throughout the day today and yesterday, I also want to recommend a different work group that would look into studying data issues. And I would like to see a work group that can come up with recommendations on how to establish a consistent and reliable data source. And I'm thinking of just data requests that we were talking about today, you know, AFCARS, human trafficking, the CCDF child counts. I also heard about FamLink in some of the comments today. Just as an example, our CCDF child counts, a lot of the data systems are relying on the census, and I think we all know that the census has not been a very reliable source of data, and Indians in particular have been undercounted and underrepresented for many years with the census, and that's still happening to this day. Although what's neat is we are seeing a huge movement in our tribes across the country getting our citizens and members into that census, sign up, sign up, sign up, which is great. But what I don't like is that our federal and state budgets are counting on these types of data sources where we are underrepresented, and therefore we cannot make good budget decisions and program allocations. And, with CCDF child count or CCDF grants in general, for Jamestown, because of the types of data sources that we are allowed to use, our funding is getting cut in half. And that's really frustrating. And some of that could be due to previous CCDF administrators here that didn't quite understand how this all works. But now that I'm in the middle of this and I'm doing more research on this, I'm sure I'm not the only tribe that is struggling. So I know that Sarah Stafford and Paul, they've been very helpful. They have heard my frustration. They are going to be discussing some maybe possible training opportunities with tribes on how we can use data to our best advantage as we're seeking grant funding. But I just want to come back to, is there a work group that we can establish? I don't know if that should be of ACF TAC members or if it should be delegated out to tribal, other tribal representatives. There's so much data need, and how can we bring this all together in a nice tied up bow like fashion? We got a lot of needs out there, and I want to see movement on that. Thank you.
Well, we're certainly willing to have the discussion about what is the best way to approach the data gathering that is within our scope of authority to gather, and would be quite willing to talk with you about those possibilities. Thank you very much for those suggestions.
Operator, we are ready to hear from the next tribal leader or designee or participant.
Good afternoon, Deanna Neswoodgishi, Navajo Nation Division of Social Services Executive Director. The Administration for Children and Families is seeking tribal input on the final rule published May 12, 2020 on the Adoption and Foster Care Analysis and Reporting System known as AFCARS. Generally, the Navajo Nation Division of Social Services agrees with the majority of the revision for the AFCARS data elements. We appreciate that AFCARS still needs critical ICWA data elements, such as a data element that captures whether the Title 4E agency inquired on the child's tribal affiliation, and that if it requires agencies still capture the child's tribal membership, as well as requiring agencies to indicate all the child's tribal affiliation. We also appreciate that these ICWA data elements capture the foster parent's tribal membership. However, the Navajo Nation maintains that more ICWA data elements should still be a requirement for the Title 4E agencies to capture data during the intake process and for tracking purposes. We understand that HHS is not statutorily required to capture more ICWA data elements, and that HHS does not see itself as a cognizant authority over implementing, overseeing, or assessing compliance with ICWA, as stated in the final rule released May 12, 2020. However, the Department of Interior is not the only federal agency that holds the government's trust responsibility as it relates to the tribal nations. We encourage all federal agencies to work collaboratively in this responsibility. Thank you.
Well, thank you very much. It appears to me that we are headed very much in the direction of the discussion of AFCARS, and since our time is getting away here, perhaps we should just go ahead into that discussion. Joe Bach, I believe, is going to lead us through just a bit of discussion here around how we arrived at what we did in the final rule. So Joe, if you're on the line, I'll turn it over to you at this point.
I'm hoping I'm still connected. Can you guys hear me?
Yeah, we can hear you.
Cool. All right. So as Jerry said, as everyone knows, the final rule was published May 12th of this year. I'd like to, as briefly as possible, go through just kind of the history of how we got to where we are today. So on December, as you all know, on December 14th, 2016, the prior administration published a final rule revising the Adoption and Foster Care Analysis and Reporting System, or AFCARS, requirements. The 2016 final rule dramatically increased state agencies' reporting burden by increasing the collection to approximately 272 individual data points, 153 of which were new. Of the 153 new data elements, approximately 65 were associated with the Indian Child Welfare Act. The majority of those 65 data elements required states to report on very technical requirements for complying with the ICWA regulations promulgated by the Department of Interior. On February 24th of 2017, a couple months later, President Trump issued Executive Order 13777, which directed federal agencies to establish a regulatory reform task force to review existing regulations and make recommendations regarding their repeal, replacement, or modification. The HHS task force identified the 2016 AFCARS rule as one in which the reporting burden may impose costs that exceed the benefits simply by virtue of the sheer number of new data elements and because the estimated burden that was published in the 2016 rule was not informed by sufficient information from the states. So in response to the task force findings, we published an advance notice of proposed rulemaking, or ANPRM, on March 15th, 2018, soliciting feedback on the 2016 final rule in order to better ascertain its true burden. 36 states wrote in response, arguing for streamlining the rule. They submitted detailed burden and cost estimates demonstrating that the 16 rule was burdensome, we underestimated the burden, and it would negatively affect their work with children and families because it focused resources more on data reporting rather than casework. So we conducted an in-depth analysis of the 18 that use AFCARS data, consulted with representatives of the Department of Interior regarding the ICWA-related data elements, and considered the concerns of all interested stakeholders. In order to determine how to best streamline the 16 rule and ensure that a new rule would not impose an unnecessary diversion of state resources, we reviewed each data element in the 16 final rule and evaluated whether it is needed for a specific purpose in the administration of the Title IV-B or 4E program, such as Title IV-B, meeting a Title IV-B or 4E statutory requirement, program monitoring, congressional reporting, or budgeting. Using that approach, a number of data elements fell out of the rule, including the Department of Interior data elements, as they cannot be used for the administration of the Title IV-B and 4E programs, and because they are associated with determining ICWA compliance, which is not within the scope of our authority. We published a notice of proposed rulemaking, a new notice of proposed rulemaking on April 19th, 2019, identifying what data elements we propose to retain. The comment period for the 19 NPRM was open for 60 days and closed on June 18th, 2019. We received 150 comments from 24 states and local child welfare agencies, 33 Indian tribes, tribal organizations or consortia, 10 organizations representing tribal interests, 45 national advocacy groups and universities, 1 member of Congress, and 37 anonymous or private citizens. We reviewed and analyzed all of the 19 NPRM comments and estimates provided and considered them in finalizing this 2020 final rule as it related to meeting the statutory requirements to avoid the unnecessary diversion of child welfare agency resources and to ensure that the data collected is reliable and consistent over time and across jurisdictions. We concluded that we did not have a sufficient justification or a rational basis for retaining the data elements that we had proposed for removal because we received no new information that was convincingly articulated to persuade us to add in data elements from the 16 rule that were not proposed in the 19 NPRM. Our goal for the ICWA-related data elements was to capture information that would permit analysis of the experiences of children in foster care for whom ICWA applied, but within the context of our authority. We did not retain ICWA-related data elements that assess compliance with DOI's regulation because it's outside the scope of our authority. Instead, the data elements that are in the 2020 final rule related to ICWA align with our authority to assess state performance in maintaining children's connection to their family, community, religion, culture, etc. So I'd like to run through the data elements that we have that are in the 2020 rule specifically related to ICWA and Native American children. So the first is whether the state Title IV agency made inquiries of whether the child is an Indian child as defined in ICWA, the child's tribal membership in all federally recognized tribes that may potentially be the Indian child's tribe, whether ICWA applies for the child and the date that the state Title IV agency was notified by the Indian tribe or state or tribal court that ICWA applies, whether the Indian child's tribe was sent legal notice, tribal membership of the mother, father, foster parents, adoptive parents, and legal guardians, whether any child in the out-of-home care reporting population exits out-of-home care by a transfer to an Indian tribe, and whether a termination or modification of parental rights for any child is voluntary or involuntary. So those are the elements that are in the rule. The rule itself actually goes into effect July of this year. We've given states 2 federal fiscal years in order to modify their systems and get themselves ready to collect and report the data. So on October 1st, 2022, states will begin collecting data under the new AFGARs, and the first submission will be due to us in May of 2023. We are holding a series of trainings that actually begins Wednesday, June 24th. We have sent around the flyer for registering, and I think we've also sent it to ANA so they can make sure you folks who are interested get it. There will be a series of trainings. This first one, again, the one on Wednesday the 24th, is open to states and tribes both, but we are also going to have trainings specifically for Title IV tribes who are required to report AFGARs. And then I'll stop talking as soon as if I could just really quickly address the question about commitments made related to ongoing or continuing collection of other opportunities for collecting ICWA data. We did say in the 19 final rule that we would, through the court improvement program, encourage courts to gather and report and analyze ICWA-related data on their side of the system. So the current court improvement program runs through fiscal year 21. The courts have a 5-year plan just like the states. They'll be submitting a new plan when the ICWA-related requests will go into the courts for their new 5-year plan that will begin around fiscal year 22, which aligns nicely with the time that the states will begin collecting the new AFGARs data. And so with that, I'll stop talking and see if there are any questions.
Operator, we have time for one more question during this session.
Thank you. Next caller, you can go ahead.
Okay, thank you. This is Myrna Thompson from the Great Plains. It's been an interesting discussion, and I agree with so much that was said. I wanted to speak to the flexibility to funding mechanisms and the Title IV foster care funds, possibly to serve families before kids end up in foster care. And I just wanted to support that because I believe that prevention is the key. And I just wanted to say that much. Thank you.
Thank you very much.
If I could also just clarify, I know there have been a lot of concerns expressed or wishes expressed about families first and the use of cultural adaptations in some of the interventions. I think it's important that we clarify for everyone that, for tribes who are operating a 4E prevention program under Families First, there is no requirement that the interventions that you choose be rated by the clearinghouse. We have that flexibility, and we've offered that flexibility. So a tribe merely needs to submit their plan to operate a 4E prevention program and tell us what interventions they wish to use and why. So, the ability to use cultural adaptations is already available to tribes who are interested in operating a Title 4E prevention program. There's no need for them to be rated and installed in the Prevention Services Clearinghouse.
Thank you for that. It looks like we do have time for one more call. Operator, if we have another person in the queue.
Yes, sure. We have one more.
Thank you. This is Lisa Rieger on behalf of Cook Inlet Tribal Council. Can you hear me?
Yes, Lisa, we can hear you.
Okay. First of all, we want to echo the comments asking for additional collaboration on the AFCAR's implementation. We really, in response, Commissioner Milner, to your question, we really appreciate the current flexibilities, and we have been urging for a really long time increased flexibilities as a way of being more efficient and effective. We are really urging all of the federal agencies to take advantage of this moment of crisis in which flexibilities have been created, and therefore then demonstrating how much more effective services can be, such as in telehealth. And so, yes, they should be institutionalized for future and remain forever. We totally support that proposal in both the 4E funding for prevention as well as the other flexibilities that have been created in response to the crisis. We have a lot of other comments. We'll save those and put those in our written comments. But to the extent that all of the different agencies cross-fertilize and feed our families from a service perspective, that is where all of this, where all the magic is made, and we really appreciate that opportunity. Thank you.
Well, thank you so very much for that.
Okay, it looks like we can transition to our next session. We'll now transition to our consultation session with the Office of Family Assistance and the Office of Community Service. I will turn things over now to Clarence Carter, Director of OFA and Acting Director of OCS.
Chairman, we're having a little bit of technical difficulty getting Clarence's numbers synced up. Give us just one moment. Director Carter, if you can hit *# on your phone so that the host can get your line open.
I don't know if Clarence knows that he needs to phone in. I don't see a phone icon. That you cannot phone in from your computer.
He was connected on Monday during the dry run, so I think he used the cell phone in addition to his laptop. This is Stan Couchstall, also from the Office of Family Assistance, and if you'd like, at some point, I'd be okay with beginning.
I think that would be great. Thank you. Please proceed.
Okay. Well, I hope that Clarence is able to chime in. My name is Stan Kautstall. I'm the Division Director for Tribal TANF Management and Regional Operations in the Office of Family Assistance at ACF. And thank you on behalf of Clarence, and hopefully he'll be able to thank you himself momentarily. But thank you for joining this call, and we'll tell you some of the latest things that are happening within the Office of Family Assistance, and then happy to answer questions that you might have. The main things that we'll be talking about today is the Tribal TANF Child Welfare Coordination Grants. There's recently a funding opportunity announcement that's been posted. We'll talk a little bit about what's happening in our world of technical assistance, and we'll also tell you briefly about a program instruction to be on the lookout for in the days and weeks ahead. But beginning with the Tribal TANF Child Welfare Coordination Grants, and even before I mention those, also within the Office of Family Assistance is Healthy Marriage, the Healthy Marriage Responsible Fatherhood Program. And they recently posted, as of I believe yesterday, funding opportunity announcements for their Healthy Marriage Responsible Fatherhood grants. And I believe that those are due as soon as like July 1st. I could be wrong about that, but you can go to grants.gov and check that out. In the last cycle, each cycle has been for a period of 5 years for the project period. And in the last cycle, I believe there were 3 tribal organizations that received funding through the Healthy Marriage Responsible Fatherhood Program. But what I'm more familiar with is the Tribal TANF Child Welfare, or TTCW, coordination grants, and we have recently posted the funding opportunity announcement for that, and that is open through July 16th. That's when applications are due. We anticipate making 8 awards of $225,000 per year for 5-year project periods. I'll give you a few details about the announcement just so you can have a sense as to whether it would make sense for you to look it up and consider applying. Applicants are strongly encouraged to propose projects leading to systems changes so that whatever improvements are made during the grant project can be sustained beyond the project period. And we've actually tried to provide lots of examples of the kinds of things that we're most interested in funding. And so it might mean doing something like revising intake and assessment procedures, developing informed consent documents that will allow for staff to share information across program lines, providing cross-training for TANF and child welfare staff, developing joint case management procedures, or developing information technology systems to enhance the coordination between TANF and child welfare. So those are a few examples. More examples are given in the announcement itself. I am personally excited about this round of TTCW grants because it builds on the previous round, in that in the previous round we provided some technical assistance and in fact in cooperation with our Office of Planning, Research, and Evaluation and their contractor, the James Bell Associates, we were able to publish a couple of reports. The reports that we published were on logic models and a collaboration assessment tool. And for the upcoming round of TTCW, both logic models and the collaboration assessment tool will be integral to the projects that are launched. So the logic models are going to be particularly important because they include performance targets for outputs and outcomes, and the logic model also describes how outputs and outcomes will be measured. the data sources that will be used, and the quality control processes that will be in place to ensure that data is reliable. We anticipate that the successful applicants that receive grants will use logic models over the course of the project, and that they will update their logic model and submit it semi-annually as a part of the regular progress reports so that we can continue to track changes with that. Also, we'll use the collaboration assessment tool, and the collaboration assessment tool is used to do a self-assessment of the collaboration across a variety of categories between the TANF program and the child welfare program, but it can also be used for any other organizational entity that's with whom there's a collaborative relationship. And doing that self-assessment will enable applicants to identify priority areas that they're most interested in strengthening. So like the logic model, we anticipate that the collaboration assessment tool will be completed and submitted semi-annually across the project period so that we can track how the collaboration between the TANF and child welfare program is actually progressing. So that's an overview of the TTCW funding opportunity announcement. It's posted, and you can go check it out and read all of the details there. But we hope that we get a good response and that we have a competitive group of applicants from which to choose and figure out who we're going to fund. Just as a side note, I will add that I think that this aligns well with some of the priorities that Clarence has for the Office of Family Assistance, in that he's very interested in casting a broader vision for transforming the safety net. And in particular, one of the concerns that he's expressed is that there's a lot of funding for safety net programs broadly, but they're all implemented in a siloed way, each with their own set of requirements and their own set of reporting requirements and so on. And the TTCW program is actually one in which we're interested in learning how can we break down those silos, particularly between the child welfare program and the TANF program, to see how, through coordination, families can be more effectively served. So check out that funding opportunity announcement if you're interested, and we'd love to receive an application. So the second item, the next two items are actually a little bit briefer, and I'm happy to continue to talk, but I'll pause to see if Clarence is on the line and if he wants to jump in.
Hi, can you hear me?
We sure can.
Okay, Stan, thanks so much for filling in. I'm having some technical difficulties on my end, and if I could, I'd like to just go back to where Stan was talking a little bit about our vision of remaking the safety net, and the sort of guiding principle behind this notion is that as it's currently constructed, the American safety net, it does not have a overarching objective or a design intention. And what I mean by that is that it is scores of single-purpose programs that were all intended to address a singular aspect of the human condition, whether that be, nutrition or housing or health care or cash assistance, and on and on and on. Okay? And additionally, it doesn't have an overarching objective to grow people beyond the vulnerability for which they need those different supports. And so what we are endeavoring to do is to propose this transformative vision of a safety net that is dedicated to growing as many vulnerable individuals and families beyond that vulnerability, and ultimately reduce their need for public supports. And so we have been working all across the Administration for Children and Families in this vision, and using our existing program suite to try to drive home some of these concepts. And so you've already heard from Stan today, and he was spot on about our healthy marriage and responsible fatherhood. That application is out, and they are due back July 1st. And I would explain that the COVID-19 hit right in the middle of our grant development process. Every year it's the same process. We begin at the beginning of the fiscal year, and we develop our funding opportunity announcements and then move them through a significant process to then make them public when we're soliciting applications. Well, of course, the virus struck right in the middle of that process, and so it has pushed a lot of our funding opportunity processes. And so we were just able to get our Healthy Marriage and Responsible Fatherhood announcement on the street, and we have just a 30-day turnaround time. And I understand that in the midst of us living and working virtually, that makes an already difficult application all the more difficult. But we've done absolutely the best that it's possible for us to do in the context of these challenging circumstances. And I want to then say one other thing, and then let you know that we've got a couple of program folks here from the Office of Community Services that can help us on a couple of those programs. As I said to you just a minute ago, the COVID-19, it hit right in the middle of our work in this fiscal year. And I cannot tell you how impressed I've been with how the federal workforce literally picked up in one day and went to all virtual. And we have at any given time one or two individuals that are teleworking or working virtually. It's the nature of the federal labor force. But without having a drill or anything like that, literally picked up and took this whole operation virtually, and have managed to continue to function and meet the objectives of our programs in the midst of this most unprecedented circumstance. And so I have spent an awful lot of time lauding the work of our agencies, because we've really kept the mechanism grinding, and so I think that covers the waterfront on the Office of Community Services front, and I'd like to, the Office of Family Assistance front. I'd like to shift to the Office of Community Services, where there, of course, we administer the Community Services Block Grant and also the Low-Income Home Energy Assistance Program, LIHEAP. And so I've got Lauren Christopher with us, who will share some highlights of LIHEAP in the context of COVID with you. And so, Lauren, could you take it away?
Yes. Hi, Clarence. Can you hear me okay?
Hi. I can hear, we can hear you fine.
Great. Thank you. Good morning, good afternoon, everyone, depending on where you're located. In terms of LIHEAP, just a few points. First of all, I want to say thank you to all of you for what you are doing to keep operations measures that you've been taking to make sure that you can still accept applications and get those benefits flowing on behalf of those households to their energy providers, while still trying to practice physical distancing and keep your teams healthy and safe. So again, we applaud you for that and encourage you to continue to take those precautions that are necessary to keep you and your teams healthy and safe, as well as the households that are seeking assistance. Some of the things we've been hearing about is that people, if you've been normally requiring in-person intake appointments for applications, that you've been waiving that in-person requirement, but still accepting applications either over the phone or by mail, or I've heard about locked drop boxes that get checked periodically online. So again, we really applaud how you've been quickly adjusting to this new way of doing business. We know these are especially stressful times, and we need to keep a healthy pace for all of ourselves to make sure we get through this okay. I do want to remind people about some free mental health support resources that are available nationally to your teams as well as the households that are seeking benefits. There's a free national phone hotline that anyone can call, and you'll reach a mental health counselor, and that number is active 24 hours a day, 7 days a week, every day of the year. I'll post the number to the chat, but I'll also say it here that it's 1-800-985-5990. Again, a completely free resource, so we're trying to share that with as many people as possible. In terms of funding related to the current situation, as you probably are aware, LIHEAP was included in the third stimulus package, the CARES Act. ACF released $900 million, which was the total amount of money that was appropriated to LIHEAP under the CARES Act. We released that on May 8th of this year, and so almost all of the tribal LIHEAP grantees received that separate LIHEAP CARES Act award letter. It would have come to you by email electronically through our grant award system. So if you are not aware of your tribe having received the CARES LIHEAP funding award, please reach out to your LIHEAP contact in our office to inquire about that, or you can reach out to me. All of our contact information is available on our website. If you just Google ACF and LIHEAP, you'll find our contact information under contacts. But there were only 13 tribal grantees that did not receive a CARES Act award letter, and that was related to how their funding is normally calculated each year. so as you might recall, the LIHEAP statute directs us to calculate a minimum amount that we would award to tribal grantees based on data we have for an estimated number of income eligible households on your reservation and adjacent public trust lands. However, the statute also gives tribal grantees the option to negotiate a higher award amount with their state counterparts. And so we do get many tribe-state agreements coming to us, and you can renegotiate those throughout the year or from year to year as needed. And again, it has to provide at least more than what we would be able to award. Some of those award letters are based on more of a fixed amount for the year as opposed to a dynamic percentage. And so for those types of agreements, there were, again, 13 grantees where they had already reached their negotiated amount for the year prior to receiving, prior to the CARES Act being appropriated. So we did rerun the numbers, and that negotiated amount would not have been increased based on the minimum that we could provide on the statute, under the statute. So if you have any questions, if you're one of those 13 tribes that did not receive an award letter and you'd like to discuss it more, feel free to reach out to me or my team. But again, the rest of you should have received an award letter on May 8th. The CARES money is basically subject to the same rules that the rest of your appropriations from 2020 are subject to. So you might recall that we released funding on November 1st of 2019, as well as late February and late April. And so the only distinction in how you can use your CARES LIHEAP money compared to the rest of your 2020 LIHEAP money is just the obligation period, how long you have to commit or use the money. And so you have a little more flexibility with the CARES money. You can use it really anytime from when March 27th of this year through September 30th, 2021. So about close to a year and a half to use the money, but it all has to be obligated by September 30th, 2021. There is no carryover limit for the CARES money. So again, just for that award letter that was issued on May 8th, you can decide to use all of it in federal fiscal year 2021, which begins October 1st of this year, or you can use it all now, or you can use whatever split between this federal fiscal year and next federal fiscal year. Other than that, it's subject to the same rules, so all the same purposes, allowable uses that you could normally use the LIHEAP money for are the same for the CARES LIHEAP money. So you can choose how to spread it across heating, cooling, crisis assistance, as well as weatherization if you offer that or want to offer that. Under the normal LIHEAP rules, grantees have a lot of flexibility in how to adjust your programs throughout the year. This is true of any year. You can always submit a revised LIHEAP plan to ACF through our online data collection system, OLDC. And you don't need our prior approval to implement those changes. Those revised plans are really for public notice purposes and making sure that we are aware of ultimately the rules that apply to your program for the year. So we've definitely been seeing a lot of revised plans this winter and spring, everything from increasing your income eligibility cutoffs within the normal federal maximum to increasing the amount of benefits available to extending application intake dates, even the types of assistance offered. Again, more about eligibility, what sorts of criteria would actually qualify a household for LIHEAP assistance. We've seen all these kinds of policy changes taken effect in light of the public health emergency, and that's all fine. Again, you do not need our prior approval. You just need to submit a revised plan within a reasonable amount of time after implementing those changes. And again, that's true of any year that you can make program adjustments as needed. If it's a substantial revision such as you weren't planning to offer cooling assistance, but now you are planning to. We would just, the statute requires that you get public participation on those revisions, and you can do that in any way that's reasonable and feasible for your tribe, whether that's calling some stakeholders in your community, if you have stakeholder group of elders and other individuals that you can talk to regarding proposed changes, or you can post it to your website for your tribe, whatever is feasible for you to allow some opportunity for your community to provide input. It does not have to be a formal hearing. Aside from the CARES Act, I wanted to provide a few updates more generally about the Federal Training and Technical Assistance, TNTA, that our team provides. As you probably recall, for LIHEAP, we don't have federal staff placed in the regional offices. We do have 4 people that we refer to as regional liaisons, but they actually are all based here in Washington, D.C. out of our headquarters office. So our entire team is based out of the headquarters office. But we do try to provide training and technical assistance to the LIHEAP grantees every year, throughout the year, through a number of different mechanisms. We also have some contractors that are located throughout the country that help support these efforts. And so last fall, in October, we issued a survey to all of our 200-some LIHEAP grantees to get feedback from all of you about the quality of the training and technical assistance that we provide. Sorry, I'm getting another phone call on this line right now, so if I'm getting interrupted, that's what's going on. Anyway, so that survey was the American Customer Satisfaction Index Survey, the ACSI, which a number of other federal programs use from time to time, including our sister program, the Community Services Block Grant. And so for LIHEAP, we issued that in October. It was exclusively focused on what you thought of the TNTA that we provide to you, including the LIHEAP Grantee Conference that we typically hold at least once a year, the webinars that we offer throughout any given year, the various websites that we maintain. We have 3 primary websites related to LIHEAP with different purposes, as well as the direct ongoing assistance answers you get from our federal team, some contractor-supported efforts, quarterly calls. There's just a whole lot of ways that we try to reach out to grantees throughout the year and answer questions and brainstorm with you about what will meet your community's needs. So we issued that survey. We did not get a very high response from our tribal grantees. We have around 150 tribal grantees that are directly funded by ACF. We received a response from 40 tribes, so that represented a 26% response rate, which was enough for us to, or for the survey group to actually make some conclusions and analyze some recommendations. In the future, I would hope that we get a higher response rate. We know that there's a lot of a big range in our tribal population in terms of the size of our tribal grantees and where you're located throughout the country. So we want to make sure we're getting a representative response rate sample rather of that survey. So we do anticipate repeating that survey in future years. We will give it a little bit of time so that we can implement some of the recommendations that grantees offered this past fall. From what we gathered from this initial response from tribes, it seemed that overall there was an average satisfaction with the TNTA that we provide. So obviously we want to improve that and have you feeling really confident in the TNTA that you get from us. We also found that
of the 40 tribes that responded, they most valued the on-site technical assistance visits that we provided, where we would send one person out for a couple of days to work directly with the tribe on 2 or 3 critical issues that they wanted to change or that we found from our monitoring reviews could use some tweaking. It also sounded like tribes really valued the LIHEAP Clearinghouse website, as well as the annual conference and the regional quarterly calls that our federal team lead. So those seem to be the top 4 things that those tribes valued in that order of priority. So that was helpful feedback. And like I said, we intend to repeat the survey in the future, so we would just encourage you to continue to monitor the Dear Colleague letters that ACF issues regarding LIHEAP. We post them to our ACF LIHEAP website. That is how we announce the survey, to flag the email coming to your LIHEAP coordinator's inbox. And I anticipate we'll be doing it again probably about a year from now. So just something to keep in mind for the future. Lastly, the other 2 things I wanted to mention were just a reminder that, again, we have 150 or so directly funded LIHEAP tribal grantees. Per our federal law, they have to be either federally or state recognized. We do get a little bit of change in the makeup of tribal grantees from year to year, as some tribes decide they want to start running their own program, and some tribes decide they would rather focus on some other things and rather be served by either their state program or a neighboring tribe's program. And so there's a little bit of change from year to year. If they are a state recognized tribe and they are seeking to become a new directly funded grantee, we will need to reach out to get specific documentation of that state recognition as part of that initial application process. And then lastly, I know there's been some discussion about 477 in recent years, and a desire among some tribes to incorporate LIHEAP in their 477. The update that I have in that regard is just that last year in 2019, HHS received applications, again, to include LIHEAP in 477 plans. LIHEAP funds are available for home energy needs based on the authorized purpose of the LIHEAP statute and the employment and training focus of 477. HHS did conclude that LIHEAP is not eligible, not an eligible program for inclusion in 477. So I think that brings me to the end of my remarks that I wanted to flag for all of you. And Clarence, I'll be happy to stay on the line if there are questions or feedback specific to LIHEAP later. And I know my colleague, Maxine Maloney, is on the line to provide some remarks about the Community Services Block Grant, CSBG. Maxine, would you like to take it next?
Sure. Good afternoon. Thank you for this opportunity to speak before the Tribal Council, Advisory Council this afternoon. I know you're busy doing some of this vital work in your communities as you're safeguarding lives, supporting families, and providing much needed care to your community. So I want to echo, as my colleagues have done earlier, our appreciation for this work. I'd like to provide you an overview today of some of the ongoing activities with regards to the CSBG Tribal. First, starting with the funding. For fiscal year 2020, Congress awarded $740 million to the Community Services Block Grant Program. This was a $15 million increase over the fiscal year 19 appropriation. CSBG tribal grantees frequently spend their dollars on nutrition programs for elders and emergency programs to shelter the homeless and prevent homelessness. We have recently released supplemental CARES Act awards to all our eligible tribes for drawdown based on actual expenditures. Grantees who applied for and received fiscal year 2020 funds received the CSBG CARES Act funds based on the CSBG allocation formula. Both the budget and the year began on March 27th of 2020 and will end in September 30th of 2022. These funds are subject to the same rules and the allowabilities, but there is increased flexibilities, and this is with regards to the eligibility guidelines. With using COVID funds, tribes have the ability to raise their eligibility to 200%. This affords tribes to provide programming and services to a broader members of their community. September 2020, states and tribes will be required to submit a CSBG plan amendment with the information specific to their CARES Act funding. This information will be submitted via our ACF online data collection system, also known as OLDC. States and tribes will be receiving additional information via an action transmittal shortly. This action transmittal will provide full details on what should be in the plan and instructions on the submission in OLDC. OCS has also released FY20 funding and CARE Act funding to BIA. These funds are for the 8 tribes who are under 477. These tribes include the Center Council for Tlingit, Haida, and our newest member, Mashpee from Massachusetts. In total, the Office of Community Services awards 64 tribes in addition to the 8 477 grantees. I'd like to talk a little bit about our TA approaches and upcoming activities to support our tribal grantees. OCS has intensified our outreach activities to our CSBG tribal grantees in this fiscal year. We hosted our first roundtable in September of 2019 at our annual conference in Little Rock, Arkansas. 23 of our 64 tribes were present with tribal representatives. This was a unique opportunity to have intimate conversations about tribal needs and ideas with regards to the Community Services Block Grant. We've also intensified and enhanced our relationship with our tribal partners with a bi-monthly webinars, and we also have a newsletter. We have a training and technical assistance team that published a CSBG tribal newsletter, and this newsletter, in addition to other resources, can be found on the CSBG Tribal Online Resource Center, and we'll leave that in the chat. That resource center can be found at www.csbgtribata.org. It keeps all the latest information on COVID-19 news, forms, applications, as well as resources. This was the first year that we engaged our tribal grantees in our American Customer Satisfaction Index survey, also known as the ACSI. This is the only standardized cross-agency evaluation of customer satisfaction in the federal government that is measured annually. Our CSBG tribal grantees gave OCS a rating of 70, which translates to good. The recommendations that we did find from these results were improved clarity with regards to our communication. Tribes wanted more of a layman's term versus the federal bureaucratic terms used in our communications. We are actively working, and CSBG staff has met to identify this and additional strategies for continuous improvement, and we'll share these strategies with you as we begin to implement them. Using the ACSI enabled us to learn more about our performance and our customer view, and our customer being our tribal grantee view on our work and our partnerships with the tribes. It also allows us to better focus training and technical assistance efforts.
This is, I'm sorry, just had a little technical problem here. This is the information I have to share with you today, and I will be around with Clarence and the rest of the team for additional questions or to provide clarification. I really appreciate the ability to share this information with you today, and again want to thank you all for your support and partnership in servicing our most vulnerable populations.
Hi, this is Jeremy Sullivan, and I just wanted to thank you all for all the information that you shared with us today. And that was a lot of information to hear. And at this time, if we have any tribal leadership or any participants or designees that would like to ask questions or give comments, now would be a good time for that. Operator, do we have anybody in the queue?
Yes, sure. We have one caller. Please state your name, title, and tribal affiliation. You just
to make, I wanted to make a comment on the idea of casting a broader safety net and sort of re-looking at a non-siloed approach. I want to make sure that we're thinking about how the 477 program works, because that is pretty much what 477 does, is being able to break down those silos and provide a broader net across all programming. I think that we should probably, before we spend time looking at developing something that is non-siloed, that we really look at how the 477 plan can apply in this case and just do what the law allows under 477, which adds a lot of additional flexibility. We also, at the Cook Inlet Tribal Council, I want to mention that we use a tool called the 5 Factors that allows us to collect information across all of our programs, between recovery services to employment and training to child and family services, about what will move a family forward. And so even if you are working within our recovery services program, but you have things that you haven't engaged with us on for child and family services, we get a really good idea about what sorts of support you need and what kind of programming you might need in that area. And it allows us to provide really integrated case management across all of those programs, much of which is funded under 477. And it allows us not to have to silo programs, really focuses on family and participant needs without looking at how it works within individual programs. So I would really recommend looking at how the 477 program applies rather than creating something new. Thank you so much for the opportunity to comment.
Thank you.
Thank you. And just for the record, I think you cut out, I believe that was Lisa Rieger.
Yes, this is actually Leanne Garrick from Cook Inlet Tribal Council speaking on behalf of Lisa Rieger.
Okay, thank you. We just want to make sure we have your name on record. Thank you.
Thank you.
Hi, Leanne. This is Stan Kautzdal, and I'll just briefly respond. I think I largely agree with what you're saying. The 477 model is a good example of a program that integrates programs that are aimed at workforce development and can help families take some steps toward getting out of poverty. And I think it's great. The TTCW program that is looking, it looks specifically at ways that the TANF program and TTCW can more strongly collaborate. And there have been, it's not new this year. It is, it's being competed this year, but it has been around for several prior cycles, which you're probably aware of that as well. But appreciate your comment.
Operator, we are ready for the next tribal leader or participant.
Thank you, Chairman. We have Tilford Denver next. Tilford, if you can go ahead. You're unmuted.
Okay, can you hear me?
Yes, sir. Please continue.
Okay, again, Tilford Denver, Vice Chairman Bishop Paiute Tribe, Chairman of the Owens Valley Paiute Shoshone Board of Trustees, which governs the Owens Valley Career Development Center, which has a TANF program that covers 7 California counties, and we provide services to 12 federally recognized tribes. So I have a few comments to make. First up is regarding ACF OFA Regional Tribal TANF Family Assistance Plan guidance. It has become more and more common that subjectivity by regional staff to tribal TANF plan language in the negotiation of plan amendments or renewals. It seems that the desire to put language understood by regional staff that may be appropriate to states and maybe other tribal TANF programs, but is not specific to the tribe in the negotiation that causes delays, confusion, misunderstanding on the specific element of the plan being discussed. California tribes have requested from the regional office the process in which the office reviews plans in order to understand more and facilitate a more comprehensive and transparent process. Consider adding these processes to the Tribal TANF guidance, the OMB control number 0970-0157, currently open to comments via Federal Register Advisory. On the OFA ACF website, the collection and availability of data is important to assessing program impact and developing legislative positions on the efficiency of tribal TANF. The national data on the ACF OFA website on tribal TANF is not current and behind the same reports for states. It is important to keep tribal TANF data on program grantees, grant amounts, caseload, etc., as current as possible in order to accurately reflect the national tribal TANF landscape for future reauthorization or reform. Next up is understanding of tribe and tribal communities. It is imperative that ACF OFA staff have some baseline understanding of the diverse, unique needs of tribes and tribal communities in order to be a true partner in assisting families to self-sufficiency and wellness. This can be achieved by spending the necessary time and effort to fully understand tribes and tribal communities, including the political relationship and trust relationship obligation the federal government has with tribes. And the last comment I would like to make again is we know that there's contingency funds, emergency funds. Tribal TANF has not received any COVID monies, but we're hoping that through legislation that we're going to be able to get additional funds. So that's my comments. Thank you.
This is Stan Couchstall, and again, I'm happy to respond if you like. I don't know, but I don't want to. I want to make sure we're following protocol. So if we're just noting comments, that's fine. But if you want me to respond to some of those, I'm happy to do so.
Yes, if you could. Thank you.
Sure. I'm not sure if that was Tilford or Jeannie, but I'll go ahead and just interrupt me if I shouldn't be responding. But in terms of, I think in terms of wanting to seek a transparent review process for plans, I mean, I'm happy for us to be as transparent as possible. And if you have ideas about how we can be more transparent, maybe that's a conversation that we should have offline, but that's certainly our goal in the program office too. I think that we try to be fair and objective and the regional staff review the plans initially, and we follow very closely what's written in the plan and how does that compare to what's required by the regulations. There's a lot of flexibility in how plans are developed, but we're happy to work with you if you have additional questions about that. I agree that the data on the website is not current and it is behind states. We're really thrilled that in the Office of Family Assistance we have a new team leader for the data team, and we're hoping to see some improvements. We're currently working with an old data system, and in the it'll probably be the next year or two ahead, there will be a new data system that's developed. But even working with the old system, I'm optimistic that we'll see some improvements there. But I totally understand your frustration that it's not more current than it is. You suggested that OFA staff have a baseline of tribal diversity and understanding for that. We absolutely aim to be culturally sensitive, and if again, that's an area. I feel like that's part of what this tribal consultation is about, so that there's discussion and conversation between tribes and the federal government representatives. But we're happy to consider other ideas that we can strengthen that relationship and come to understand each other better. I've been particularly mindful of that in just with all the circumstances following George Floyd, which I understand he's not a person of indigenous descent, or at least not to my knowledge, but still it struck a nerve across the country, and we need to be sensitive to the concerns of minority populations and marginalized folks, and anything we can do to improve on that, I'm certainly open to that conversation. And lastly, you noted Tribal TANF has not received any supplemental funding. That's true. And as I think you also know, that's more of a legislative issue than something that we have influence or control of in the executive branch. But we'll certainly keep you informed as soon as we become aware that legislation is passed that would have an impact on the Tribal TANF program. Thanks for your comments, as always, Tilford.
Operator, we have another call.
Yes, we have 3 more calls in queue. If the next person could state your name, title, and tribal affiliation, your line is open.
Yes, this is Gail Hatcher with the Klamath Tribes in Southern Oregon. And I'd just like to make a quick comment about the TANF. We're very appreciative of the fact that we could do face-to-face with our clients, and that is something that we would hope to continue after this COVID crisis. Also, I know that there are other programs that have also allowed face-to-face, and that's been very helpful during this time, and it's also something that could be very helpful even when we're not in crisis. So I just wanted to make that comment quickly. Thank you.
This is Stan Kautstall again, and just thank you for sharing that comment. I think that the flexibility of the TANF program certainly allows for your discretion as to when it makes sense to incorporate face-to-face meetings, and when, because of COVID or anything else, you need to do virtual meetings. I think that there's a lot of discretion that you have there to do what makes most sense for your tribe.
Operator, can we have the next tribal leaders' questions or comments?
Yes. The next caller will please state your name, title, and tribal affiliation. Your line is open.
Thank you. Good afternoon. This is Charlene Abrahamson, and I'm the Family Services Director for the Squaxin Island Tribe, speaking as a designee. And thank you all for your time, and hopefully I'm not getting into the weeds too much, but earlier in the discussion from Stan and then Clarence on the grants and removing silos, here at Squaxin Island Tribe under Family Services, I have both the ICW and the TANF program, but the TANF program is operated through SPIPA, the consortium that we work with, and that's a wonderful partnership. So under that, I heard discussion on getting informed consent and how to communicate across programs better, which even though we operate together, we could always enhance that. One of my thoughts on working on that is that often we have fathers within both programs who could benefit from group types of work. We have somebody that we've worked with often in this area who does relationship life skills and is a licensed mental health counselor, and we've had really great outcomes from that. And I wonder if that type of program would be something that would fit into the grant as your vision of it and what you see. Thank you.
So this is Stan Kautzdal again, and I'm limited in how I can respond because I can't provide, for me to endorse or suggest that, yes, that you got a winner there. I need to be cautious about providing information that's not given in the program announcement, and I wouldn't be able to give, for one tribe, an unfair advantage that another tribe doesn't have. We do provide lots of examples of the kinds of things that we're looking for, and they're very much aimed at collaboration between the TANF program and the Child Welfare Program. And I think the activities that lead toward those systemic change, whether it's informed consent or whether it's fathers that are being served by both programs, and ways in which those programs might coordinate a licensed mental health provider. So, like, I think that there's, if you read the funding opportunity announcement, you'll see the flexibility that exists and the kinds of changes that we're most interested in observing and funding.
Great, thank you. I could have worded that better, I guess more direct service versus programmatic, but that does make it clear, and I understand your limitations and how you can answer that. I always think of our grant writers and making sure I'm not throwing things their way that would not stand a chance, but thank you so much. I do appreciate that.
Yeah, so I will comment. I think that this is in the funding opportunity announcement, but in some ways it's less about funding supplemental activities that couldn't otherwise be afforded, and it's more about creating efficiencies between the two programs that can be sustained. And so those are more systemic changes, and it's the systemic changes that we're most interested in funding.
Great. Thank you.
Operator, this will be the last comment, and you can add additional comments in the chat box as well as send additional testimony in writing for any comments or testimony we did not hear today. Is there one more commenter?
Please have more. Thank you. If the next caller would state your name, title, and tribal affiliation.
Good afternoon. I'm again Deanna Nesudgishi, Executive Director, Division of Social Services, Navajo Nation. Director Carter, Director Kalstall, and I'd like to also do a shout out to Deborah Samples, Regional Program Manager, Children's Bureau, Region 9, and Michaela Smith, Family Assistant Program Specialist, TANF Region 9. We have monthly discussions with them. So the ACF is seeking tribal input on a recently released funding opportunity, the Tribal TANF Child Welfare Coordination Grant. The funding opportunity was released June 1st, 2020, and the grant application is due July 17, 2020. This funding opportunity is a demonstration grant. The Navajo Nation is happy to see the release of this funding opportunity as the nation's Division of Social Services has recently completed a division-wide infrastructure assessment that proved insightful. And this is 44 different offices in Arizona, New Mexico, and Utah. From this assessment, Navajo Nation Social Services has identified that 95% of the computers in use by the division staff have computers that are well past their technological lifespan. They call it end of life. In addition, we learned that some of our branch offices do not have access to reliable broadband. Lastly, we identified that social services is a very large division and that each program within the Division of Social Services would benefit from more high-level coordination. We have about 620 staff within our division. The Division of Social Services has begun making inroads in coordinating TANF and our Child Protective Services program. The Division of Social Services is moving from individual case management systems to a centralized case management database. We will still maintain necessary confidentiality between each program. This centralized database system allows Child Protective Service social workers and the TANF case managers to work together on reunifying families and providing additional supports to grandparents caring for their grandkids. The Navajo Nation plans to apply for the Tribal TANF Child Welfare Coordination Grant funding opportunity. This grant will help us continue the momentum that began with the infrastructure assessment and long-term system changes across the Navajo Nation. I also want to add on that in response to Director Carter's comment on the Office of Family Assistance, it is to reduce the need for public support. When we look at TANF purposes 1 and 2, to provide assistance to needy families so that children can be cared for in their own homes or in the home of relatives, and the TANF purpose 2, and the dependence of needy parents by promoting job preparation, work, and marriage. So I just want to give a real brief scenario when we talk about integrating TANF and protective services. We had a situation where we did allow a customer, former customer from TANF, to present to all of the staff. And so the individual indicated that she was at her wit's end. She felt she had nowhere to go, and she felt that taking her life was probably in her children's best interest. She was doing some unfavorable behaviors, using substances, and the children were at that point being neglected. And so a coordination effort from the community referring this family to the Tribal TANF program, they coordinated together. And so through the TANF program, they're required to do work participation hours. And so TANF changed the plan for that customer to have the plan, the approved work activity, to work with the CPS worker to address that case plan. And they use the supportive services to help that individual to go through vocational training. We have to give supportive services. There's that short-term non-recurring benefits. And so that full support of the TANF worker and the CPS worker case managers did wraparound services for this individual. She completed her CNA, which TANF had provided covered the cost with the supportive services. The individual got her CNA license, again with TANF providing that supportive service. This person has a job at one of the medical centers working full-time. She was transitioned off TANF. She has her children. And so when we talk about some of these initiatives, this is something that the Navajo Nation has been working on, and I know all the other tribal TANFs on the call are doing the same. And if we have these grant opportunities to streamline and enhance what we're trying to do, this is going to be helpful. And so when this individual presented to all of the TANF staff, she was thankful, and she's moved on, and she's doing well. She's no longer on TANF. As Director Carter had mentioned, is to reduce the need for public support. She is doing quite well. It's been over 2 years, and she's doing really well with her children. And this is what we're here, having these discussions with the other tribes and ACF, that we're doing the work, and this additional coordination and support from ACF will do well. And this is what we want to continue to proceed with. Thank you very much.
This is Stan Kautstall, and just thank you so much for sharing that client testimonial, essentially. It's always inspiring to hear those cases in which the services that are funded through our office actually benefit somebody and leads to positive change in outcomes. So thanks for sharing that. While you were speaking, I got a message from Clarence Carter, and he's had technical difficulty and hasn't been able to respond, but I'm sure that he's encouraged by those kinds of comments as well. As far as the TTCW funding opportunity announcement, wish you all the best in your application and look forward to receiving it. So thanks for sharing some of your plans.
Okay, thank you for sharing your testimony, Stan, and Clarence and team, thank you for your participation this afternoon. We're just a little bit behind schedule, but it's always great to hear of the great work taking place in the community. So thank you for sharing. I have the pleasure now of introducing somebody that I have so much respect for. We are moving into the Office on Trafficking in Persons, which is an office within the Administration for Children and Families. They are a small office with a relatively small budget, but they are doing huge work across the nation in regards to combating human trafficking. And I had the honor of traveling with the director of the Office on Trafficking in Persons, Dr. Catherine Chan. Almost a year ago, we hosted roundtables in Hawaii, Saipan, and Guam. The Administration for Native Americans, part of the population that we have the honor to serve is our Native Hawaiian relatives and the Chamorro and Carolinian population in American Samoa. And so we did go over and hear from them about the human trafficking in their communities. Catherine and I also hosted several roundtables and listening sessions at HHS regional consultations and heard from several of our tribes about how important it is to start educating individuals, families, communities, federal agencies on what is human trafficking, how do you identify it, and what do you do when you do identify human trafficking taking place. So that's what this next session is dedicated to. Director Catherine Tron has been an amazing partner with ANA. We've developed some resources and tools that are specific to our Native populations. And even though it says that this is on human trafficking in tribal communities, we expanded that to tribal citizens and the tribal population because a lot of times the human trafficking is taking place in urban settings and off the reservations also. So we want to make sure that when we are tackling this issue that we're representing all Native Americans, whether they live in their tribal communities or in urban settings. So again, I just have so much respect and admiration for Dr. Chan. So thank you for being here with us today, and I'm going to go ahead and let you present now. So Dr. Chan.
Great. Thank you, Commissioner Hovland. This is a point of the year I really look forward to because I'm able to provide a feedback loop on everything that we've been able to make progress on based on the consultations with various tribes and Native community organizations over the years. And this year we have made even more progress with the partnership of the Administration for Native Americans. I want to recognize that Beth Fenning, our liaison for Native community programming, is also on the line in case you may have any questions that she can answer. I want to do more listening than talking, so I'll keep my remarks very brief in regards to some of the progress that we've made and a couple of questions that I have for the group on this call. Just to highlight some progress that we've made, I wanted to note that there are several new grant opportunities that are out right now. There's a grant opportunity to assist domestic victims of human trafficking, and the one that you see on this slide is a demonstration grant, and it's our very first where we specifically focus on organizations assisting victims of human trafficking in Native communities. The due date for that is on July 6th. And we heard loud and clear that there was need for more support specific to the culturally and linguistically appropriate services needed in Native communities. So we're eager to see what kind of proposals come in for that grant opportunity. Second, in terms of capacity building, last year we partnered with ANA and piloted various trainings with many of our partners who may be on this call regarding the release of our SOAR to Health and Wellness online training module for Native communities, and specifically for healthcare providers, public health, behavioral health, and social service providers working in American Indian, Alaskan Native, Native Hawaiian, and Pacific Islander communities. And this is an online program that's available for free, can be taken at any point. And then we also have some in-person trainings that we've put to the side because of the COVID-19 response and social distancing guidelines that are in place. And then there are several other resources. The Commissioner may have mentioned the Native Youth Toolkit. There is a robust interagency commitment to addressing human trafficking in Native communities, which also intersects with murdered and missing Native Americans. And so there are some resources on there. The two questions that I have, and happy to answer any questions that you may have, as we're looking forward to the programming ahead, one question is what public awareness needs and strategies do you see in your communities? One of the reasons I ask is because we have a national public awareness campaign called the Look Beneath the Surface campaign, and we're looking into developing new resources that may be helpful for underserved and underrecognized communities disproportionately impacted by human trafficking. So are there particular communication tools, campaign, public awareness resources, target audiences that are particularly important for you? And then secondly, in regards to research and data and policy, what are the priority research and policy questions that you're asking yourselves as tribal leaders and leaders in the non-government and social service sector that we could see if there's a possibility for us to help look into or partner together on regarding priority research and policy questions in anti-trafficking efforts. So I'll end there to take questions because of the limited time, but also happy to hear any ideas that may come from this call and during the rest of the consultation period where there's still time available to submit comments and questions.
Operator, I'd like to ask first if any tribal leaders wish to make a comment at this time or answer those questions. Please remember to state your name, title, and tribal affiliation for the record before making your comment.
Thank you, Chairman. We don't have anyone in queue just yet. If you'd like to comment again, please press * pound to enter the queue.
So while we're waiting, this is Commissioner Hovland. One of the resources is the Combating Human Trafficking in Native Communities, Native Youth Toolkit. And this is a free online training. It's a PDF form. You can download it. It's age appropriate. It's culturally appropriate. We had our ANA Native grantees youth look at it. We had them look at it again last year. This is a really great tool to get parents, to get school educators, after-school programs to talk about this issue of human trafficking. What is it? Do you know that what do you do if you know it's taking place? There still is this misperception that human trafficking is what we have seen in the movies with the Liam Neeson movies where somebody comes in, takes somebody away, and they go to a foreign country. Does that happen? Absolutely does. Unfortunately, it does. But there is a lot more taking place in our communities, people we might know, people that may be in our family, the internet. So it's a really good resource to talk about a difficult subject and guide that discussion. Catherine actually it was Liz and then Michelle Sauvé, so ANA and ACF, OTIP recently trained several Bureau of Indian Education staff so that they know about this kit that you can see now on the screen if you're in your computer, and that they can train and have this done in their schools, in the BIE schools. We'd love to get it to our tribal schools. It's already available on our website. And they also train the Johnson O'Malley facilitators, and we are looking at continuing to do more training on this along with law enforcement. So I just want to make you aware of that this is available, but we really need to hear from you on how we can support this issue and provide that education in your communities.
Commissioner, one other thing, because you brought up the toolkit, I mentioned there's an open funding opportunity for victim services, but we also have an open funding opportunity for prevention education programs in schools for any tribes or Native communities who are looking at implementing or strengthening prevention education for K through, or yes, I think it's K through 12 students.
We do have one caller in queue. If you could please state your name, title, and tribal affiliation. Your line is open.
This is Myrna Thompson, Tribal Secretary for the Sisseton-Wahpeton Oyate of the Lake Traverse Reservation in South Dakota. And this is a very important topic to me. And unfortunately, it is happening in our tribal communities. And I look at it and I see so many different issues that's attached to the human trafficking. And it is all interconnected, the MMIW and girls, the addiction, the trauma, the lack of awareness. And recently we had a case where, this young lady, she was traumatized in her younger years, but yet because of, I believe, self-esteem, it led to her being trafficked. And it's all related, and I know there's a lot of education that needs to be done in our tribal communities, in our school systems, in our law enforcement. And I believe we almost need a program just for these different topics. So we can do effective public campaign, educational awareness campaign on this topic. And we don't know, I mean, I still would like to know an accurate number of how many of our people are missing, the MMIW girls and men. But the importance of this, to me, is just right at the top of our list, because there's so much healing that needs to begin. And it all ties in with families. It all ties in even with the TANF and the child welfare connectedness with that new grant. So I think there's a way that we can address it in our communities, but we need to tie it all together. I'll be interested to look at the toolkit. But I just wanted to make that comment and that statement that this is one of our top priorities. Thank you.
Thank you so much for that. I appreciate everything you said, and you're right on. It is all interconnected, so we can't just address one issue without addressing all. And the stigma that comes with survivors that come out of human trafficking, sex trafficking, helping our communities know how to support victims. I think Catherine might have mentioned that we had our first ever Native specific cohort on human trafficking, and they will be graduating. We funded this cohort of survivors and providers that see victims of human trafficking, Native human trafficking, looking at culture as a preventative factor, and we're looking forward to the white paper to guide our federal agencies as we look at this issue. But we need this to be survivor informed when we address this, for prevention, for bringing back home to the communities and helping communities know how to support survivors and help with that stigma, which is, I think, a lot of why it's not being talked about in our communities, is because of stigma that comes with it. And there's a lot more of our members, men and women, that either aren't aware that they're human trafficked or just don't want to have that stigma. So it's a tough conversation that we need to start having.
And Commissioner Hovland, I wanted to note that the current class of the Human Trafficking Leadership Academy that you mentioned, they'll be having their official graduation on Thursday, September 10th virtually. So we would invite any interested ANA partner or stakeholder to listen in on some of those recommendations, and then we'll post their written set of recommendations on our website as well.
Operator, do we have any more commenters?
Not at this time, Chairman Sullivan. There's no one in queue.
Catherine, could you just brief us a little bit on what human trafficking is under the Administration for Children and Families program?
Sure. So we follow there's a federal-wide definition of human trafficking, which includes forced labor, commercial sexual exploitation. So essentially, any time someone is induced into some type of work through force, fraud, or coercion, whether that's an adult or a child, they could be a victim of labor trafficking. And then for any adult in commercial sex who's in it through force, fraud, and coercion is a victim of sex trafficking, and then any child, regardless of force, fraud, coercion in commercial sex, is a victim. And so what we often see is there's a lot of attention on sex trafficking, especially in the context of COVID. We've seen increased reports of online grooming and recruitment, online exploitation, where then the online abuse turns into in-person and offline abuse, and that's impacted urban, suburban, rural communities. So we've seen that as a significant recruitment tactic. We've seen forced labor cases in agriculture, manufacturing, domestic work, any type of labor. There are certain industries that have been at higher risk for trafficking. Many on the call may already acknowledge the role of extractive industries and local market dynamics on labor and sex trafficking. So those are all things that we're monitoring at a national level, and then having conversations with state, tribal, local communities on how human trafficking isn't just impacting individuals and families and communities, but it's also impacting these various industries where forced labor may occur. And so one of the hardest parts for us in terms of raising public awareness is that victimization is so, the ways traffickers exploit look so different across the board. So some people may have a greater understanding of child sex trafficking, but may not understand as much about forced labor and labor trafficking. And so we're really trying to bring attention to all those forms of trafficking through the public awareness campaign and the prevention education programs.
And so, thank you, Dr. Chan. Some of the things that we've heard about that help me to understand this more is like somebody that's under the age of 18 and they are being solicited to receive, say, money or clothing in exchange for sex. That is considered sex trafficking, correct, Catherine?
Yes, or someone who is applies for a job thinking it's one thing, but they're made to pay recruitment fees, or the conditions of the job change and they can't leave, or they may be trapped into some type of debt bondage scheme, whether it's either sex trafficking or labor trafficking. So traffickers use like a variety of ways of manipulating, controlling individuals through threats of physical harm, psychological manipulation, financial and economic forms of control. So it really runs the gamut. And what we're being mindful of, especially in this COVID context, is, as I mentioned, the online recruitment, but also what's happening in various parts of the labor workforce in terms of the working conditions, and are people truly there out of their free will in labor, or are they being deceived or controlled, forced in some way?
Thank you. And I think we're seeing in the Native population more of the sex trafficking, so we want to talk a little bit more about that, and the opioid and substance abuse issues, how really preying on folks that have an addiction and getting them their drug of choice in exchange for sex. That's what we know more about, that we see in our communities, our populations that we're dealing with, and just preying upon vulnerable populations, those with trauma, those that are homeless and need a place to stay. So those are things that we want to get education out about, is that it's taking place. Some people think it would be prostitution, and there is a definition for it, but really when we look at sex trafficking in our communities, I think we need to really simplify what it is and what we're seeing in those cases, because that's where I think we're missing the mark about human trafficking being very infiltrated in our society.
We have one last tribal leader that would like to make comment or has a question. If we can have this be the last comment on this section of the agenda. If you'd still like to add comments, you can put them in the chat box, or you can write them in. So, operator, can you please let the last person in?
Hi, Ait Squatchy. This is Lonnie Greninger, Vice Chairwoman for the Jamestown Squalum Tribe.
Hi, Lonnie. We can hear you. Please go ahead.
Great. Thank you. I know that last year at the consultation we had briefly chatted about data tracking, specifically for trafficking. And one of my suggestions last year was maybe searching out tribal businesses that the feds would be able to contract with to be able to help build those systems, because tribes, we have specific data sets that we would be wanting to see, and we would also want to look into data sharing agreements just to make sure that we have our data sovereignty protected as well. So I know that I was going to help a little bit in communications with you, and I let that drop off, but I wanted to know if there was any movement on that.
Yes and no. We have, in partnership with ANA, we've consulted with tribal epicenters, different researchers, and organizations collecting data on various crime and violence issues, including MMNA and, to a certain degree, trafficking. There is not yet a national strategy to figure out how, who, and the who, what, where, and how. Some of the discussions have centered around tribal data sovereignty and how the data is collected and who maintains and analyzes it. There has been progress at the federal level in terms of issuing funding opportunity announcements. It's primarily been through the Department of Justice generally on human trafficking research and data collection that could be inclusive of human trafficking data in Native communities. So we've been making progress through these various conversations and consultations to figure out what is the appropriate role of a federal agency like OTIP on how we could best support the needs on the ground. And we'll continue to work with ANA or other partners to figure this out. The roadblocks we keep coming into is the data sharing agreements and who will collect the data, how would it be shared and analyzed, and then so that's kind of where we are right now. And but there is a lot of potential for collaboration, and we would be eager to pick up on some of the interest that you expressed from last year.
Great, thank you. And I know earlier I talked about a data working work group, for lack of a better term, and this was one of the subjects that I had listed in there, along with AFCARs and the CCDF child count and family and things like that. So I don't know how much support this would gather from other tribal leaders out there, from our ACF TAC members, but I really like the idea of a work group, everyone, especially when we got all these data needs out there, and to help brainstorm how we can protect data, but also make sure that we're able to use it and be able to benefit our tribes for it. Thank you.
Thank you. And this is Commissioner Hubble, and I just wanted to add to that also that that's what the Operation Lady Justice Task Force is really looking at, is data. And as Catherine talked about, what, where, and how. So what kind of data do we want to collect? And we hit on this a little bit earlier on the discussion of just the first part that we need to start with is within ACF, and Principal Deputy Secretary Lincoln agrees that we need to encourage and educate our programs that we fund, that at screening that they have an option for people to self-report as they're Native American, and that these agencies, whether they're state, local, or federal, are not defaulting back to Caucasian or other if a person marks that they're Native American and Caucasian or Hispanic. So there's a lot we need to do just to start capturing data, no matter what it is. And then we also have to determine what data do we really need that is going to really help us to tackle this issue. And so it would talk about our vulnerable populations under ACF. It is something that we are having a lot of discussions about. It's part of what our ACF MMNA framework that we're working on to address high risk and vulnerable populations is going to be looking at. But this is something that's going to have to be shared across the agencies because it's just a lot of information, a lot of data, but it is being looked at. I love your idea of having a data work group, and it is something that we're going to put on our agenda to discuss at our next ACF TAC meeting.
Well, I certainly appreciate this discussion, and Director Chan, I really appreciate the work that you're doing. It's so important in Indian country. I would suggest, as a former IT guy, that you consider platforms for your databases to be consistent and be able to be searchable for your clients. That's really important. We run into those problems in Indian country a lot where people don't have similar databases, so they have problems being able to have access to the data. So we will now transition, if that's okay with everybody. At this time, we will open up the consultation to any topics that have not been addressed. We will continue to follow the protocol of tribal leaders speaking first, followed by designees, and then others who would like to ask questions or provide comment. We ask that when it is your time to speak, that you would please provide your name, tribe, or title, tribe, or your organizational affiliation. When you're ready to give statements or ask questions, please press *# and you'll be placed in the queue. You may submit questions by typing them into the chat box also.
Operator, while we're queuing up callers, I just want to mention also part of the barriers that we also found in regards to human trafficking and the MMNA is coding and being able to interface those codes and having a uniform code so that if they're seen at one facility, of course, protecting the person, the client, that we would be able to have that coded, have a uniform code. So I am happy to say that IHS has been working on that.
Thank you. We have no callers in queue at this time. Sorry, Commissioner, go ahead.
Oh, no, that's all right. I was just going to say, at this time, you're welcome to bring up any issues that you feel that you wanted to talk about a little bit more, or that you didn't have the opportunity to ask about, or we can carry on with the conversation on human trafficking. Feel free to answer any question or ask any question you would like. Again, you hit *#. Yes, we have a question about the article that will be coming out, will be in Fortune magazine regarding missing and murdered Native Americans, which is an op-ed that I have authored. Please follow Administration for Native Americans on our social media. We have Facebook, we have Twitter, and you can go to ANA's website and sign up to get email notifications of our funding, of articles and information that will be coming out also. I also want to remind everybody that our funding opportunities are open for social and economic development strategies, very flexible funding. I have bonus points for projects that would include missing and murdered Indigenous women, human trafficking, elders, veterans, and first responders. That funding is available. You can go to grants.gov. It doesn't have to include any of those populations, but if it does, there will be additional bonus points added to the score. We also have our native language grants that are available until July 1, and our environmental regulatory enhancement funding available July 1. The social and economic development is available until July 15th. We have free online pre-application training available on our website. We did them all virtually. We video recorded them. So if you missed that training opportunity, you can watch it online. Go to ANA's website. I don't believe we have any callers yet, so I'm going to say I'm also excited to announce that after hearing from many of you for years about how the funding often doesn't go to tribes that need the funding the most but are not able to compete because of capacity issues, we have the SEDS Go for growing organizations and tribes to help you build your capacity, to help build and incorporate internal controls so that not only are you able to compete for federal funds and private sector funds, but be able to have it in compliance. That's called FEDSGO. That funding is a new initiative that we introduced this year, and you can go to grants.gov for that also.
It looks like we may have a tribal leader or a commenter.
Chairman Sullivan, they dropped from the call. We have no callers in queue.
Well, I know it has been a very long afternoon and 2 afternoons for some of you. I want to thank you for making this year's ACF consultation a priority of yours and being adaptable and flexible as we went virtually with this during the pandemic. Please know we continue to keep you and your communities in our thoughts and prayers. We'll go ahead and look forward to wrapping up the session. As a reminder, the record will be open for 60 days and written testimonies may be submitted during this time to anacommissioner@acf.hhs.gov. Also, as a reminder, any comments you have submitted in the chat box will also be included as part of the record. I want to thank you all for your input and impactful dialogue as we've received over the last 2 days. Please know that ACF leadership values and relies on your input as we develop our policies and budgets that impact Native Americans. It is our privilege to have the opportunity to work in partnership with you, and we are committed to honoring our government-to-government relationship. Wopita Tonka, a huge thank you to Chairman Sullivan for being the tribal facilitator for this historic virtual consultation. We are now going to ask Chairman Andrew Maltese from the Wampanoag Tribe of Gayhead, Aquinnah, to close in prayer. Chairwoman?
One moment, Commissioner Rowley. Go ahead.
Thanks. Did we lose connectivity?
I think so. It'll be just one moment, Commissioner, while we get her in queue.
Thank you.
Commissioner, I just wanted to also thank you and your staff for all the hard work. And this was interesting in the beginning, and I think it really went well throughout both days. And you have really good staff, and we appreciate all the hard work that's happening in the administration of children and families. We know there's a lot of work to be done, and we're all trying to make it all better all the time. And I really appreciate you and your staff. So thank you for the opportunity to co-host with you. And I really enjoyed the time, and I learned a lot in the last 2 days. So thank you very much.
Thank you, Mr. Chairman. You've been very gracious facilitator and very patient, and you did a fantastic job. So it's been a pleasure. I did lose connectivity. I'm not sure if anybody else is still on.
I was going to say, can you hear me now?
Oh, we can hear you, Chairwoman.
Great, thank you. And thank you very much, Deputy Secretary Hovland and the entire team for what has been a very, very informative, interesting, respectful, and interactive consultation. I really did appreciate being on for the past couple of days, even though uncharacteristically didn't say a lot. Anyway, thank you again, and thank you for the honor of being able to close and present a closing prayer. We're all connected through this electronic means, but know my hands and my heart are touching you as I speak. Creator, thank you for all of the many blessings that you've bestowed upon us. Thank you for our Mother Earth, the waters, the skies, the sun, the moon, and all of our brothers and sisters who live within and upon her. Thank you for our ancestors who have gifted us with their knowledge and their love. Thank you for the people, our family, our relatives. Thank you for all that you provide for us. And we thank you for all of these dedicated people who are working tirelessly on behalf of their communities and all of our peoples. We humbly pray for your continued guidance. We pray for your grace and strength. We pray for all the families who are suffering. We pray for the physical, emotional, spiritual health and well-being of all the peoples. We pray for your continued blessings on our elders and to protect our children and our future. We pray for an end to all of this uncertainty and unrest. We pray for your wisdom to help us help heal our communities and ease the pain of all who are suffering from all of these tragedies. We pray for your healing powers to touch all of us and to get us through this crisis. We thank you for allowing us to share our good thoughts and our ideas to help the people, and we thank you for the gift of our presence in this world at this time. Aho.
Yamiye, thank you so much, Chairwoman, and it's an honor. Thank you for everybody who called in and who listened and for your input. And again, we will be getting back to each and every one of you in writing. And thank you, and continue to keep doing the great work you're doing in your communities. Thanks again, everyone.